All right, it's 9:30. So I'd like to open up the work session on SB 371. And there's a proposed change, so I'll introduce the content to the subcommittee and then we can discuss it. Last time we met on 371, there wasn't a great deal of opposition from the subcommittee to the underlying content of the bill. Basically, resident doctors were looking for well, actually, the administration, I would say more, Dartmouth was looking for an exception to the 2-year filing period for renewal of license because they do it on behalf of the resident doctors, because obviously the resident doctors are working like 80 hours a week, so which is completely reasonable. So we didn't really have any problem with the content of the underlying bill. Since that time, I have had some further discussion. I've gained some more information. And so my personal position on the bill has changed. And I'll give you my reasons why. In order to grant an exception, in my opinion, from the 2-year licensing requirement, we'd have to really prove some sort of substantial hardship that was being caused to Dartmouth. Because really it's a bill for Dartmouth, either from a monetary perspective or from a time perspective. It was either going to be really overburdening for them from a time commitment, or it was going to cost them a lot more money. And in either case, I was willing to make the exception to the rule. On the money piece, I learned that the fee is $50 to renew the license, because the point of licensing for each individual. Because the point of licensure is not to make money, they're not trying to turn profit on it. If they have to do it more frequently, they'll just reduce the license fee. So if they have to renew, one extra time, instead of it being 50 for the full term, it'll just be 25 for the 2 times that they have to file. So there's no financial hardship that's going to be incurred by the hospital for this to happen. I also learned that OPLC will not and has not, I mean, if we tell them they have to, then they will, but has not ever gone more than 4 years on a license. So the maximum number of renewals that are going to happen in this situation are 1 at the 2-year mark. With 450, approximately 450 resident physicians at Dartmouth, I'm assuming staggered, that's an average of just over 100 people who are going to be looking for renewal on an annual basis, is basically what they're going to have to come up with. So the last question that, for me, I thought needed to be answered was whether a time hardship was going to be created by the number of things that they were going to have to do. So I looked into the process. I can share it with the subcommittee. I don't know if you guys have ever had to deal with license renewal in the state. I do for a food service license. So I'm familiar with the process that Director Courtney was sharing with me, where on your initial license application, you'll fill out all of your information, you'll submit it to the department. When you get your renewal, basically all of the information is filled out for you. You just have to verify that nothing has changed. Say nothing has changed if nothing has changed. And I'm not sure exactly how OPLC will do it, but in my case, I don't have to respond if nothing has changed. I just send in my renewal fee and I'm done. So if it takes 5 minutes per application renewal, which, looking at the application renewal, in my opinion, I don't think it would take really much more than that, if that, depending on how OPLC, fine tunes that application process. It's about an 8-hour workday for one person once a year. And to grant an
one OPLC staff.
No, one person at Dartmouth filling out the renewal applications, about a day's worth of work once a year. And as soon as you start granting exceptions to the rules, then everybody's going to want an exception for this reason or that reason. So I mean, I'm fine. I was fine, and I still am fine. If I felt like there was truly a hardship that was going to be put on Dartmouth, we don't need to do that. I don't think anybody has a desire to do that. But that's got to be balanced by being even-handed across the board as well. So I personally, after looking into it a lot more closely, could not find the financial hardship, because they're just going to reduce the fee so that they're basically spending the same amount of money. And when I was looking for the time hardship in the end, I couldn't find that either. So that's kind of where I landed on the underlying bill, and I'm more than happy to open it up to the subcommittee for conversation. Go ahead, Peter.
Thanks, Mr. Chair. So the thing is, this is going to be done by mail, or is it potentially going to be done electronically?
No, it's going to be done electronically.
So in other words, it'll come up on the computer or the cell phone of the individual resident doctor that's affected. He or she will potentially push the button on their cell phone or on their computer or whatever, and if there's any change, he or she will make that change. If not, they'll just no change and they're good.
So it probably won't be the resident physician. It'll be an administrator at Dartmouth Hitchcock.
Even better.
Yes, but the way that it works, the way that I've engaged with this system, and it sounds like talking to the director, this is what they're heading towards. You will receive a paper in the mail that says, here's the information that we have on file. Has anything changed? Now,
Right.
being a residency, more than likely nothing will have changed. And what they do in my case is they simply say, if there are no changes to be made to the application, don't respond. We'll just assume that it's here, and if we receive your filing fee, then you'll be renewed for another year. That's how it happens in the food service industry anyway. And it sounds like this process will be the same. So yes, but it will be online. So if you do have to make changes, you can, go into the portal. And if you're doing 100 of these, obviously you get into a rhythm. Exactly. The staffer will be doing it. At least that's what they're saying. They could always push it off to the resident physician if they want to. That's their choice. They're doing it because they're helping their physician out, which I appreciate because those people are working extraordinarily hard. So it would be a system like that. So once again, we're, maybe 100 of these, 120 of these in a year. If it's for the vast majority of them, if it's just the time it takes to write a check and send it in the mail to OPLC, I can't find the hardship in that to grant the exception personally. Steve? Yeah, I just couldn't find the burden. And once again, if I could find the burden, I would do it. I'm not trying to cause them any problems. Yeah, absolutely. Give me 1 second. Any other comments from the committee? I'd love to hear from the public. If you guys want to testify, come right up to the mic, please, and just turn it on. Good morning.
Good morning. Thank you very much, Representative Simon and members of the committee. Recognize that it's a work session, so appreciate the opportunity to speak to it. We're here to speak to the bill.
No, and please do, because we're still talking about the bill. So yeah.
Great. So for the record, my name is Matthew Hood. I'm the Vice President of Government Relations at Dartmouth Health. You're probably used to seeing my colleague Courtney Tanner, who's out of state today. And with me is Chelsea Nolan, who's the administrator of the residency program, director, of the residency program. So has insight into the actual nuts and bolts of the operation of this program and what the failure to implement a variance or, for lack of a better word, would entail for Dartmouth Health.
Excellent. Thank you for being here.
So to some of the points that you made, thank you for looking into the process thoroughly and from speaking it from your experience with regards to the food industry. What we have heard from the OPLC during this process of change is that there would be, yes, the move to an electronic, can you hear me okay?
Oh, yeah.
To an electronic system, but as yet not in place. Currently, what we have is a paper renewal process that does not follow the process that you have identified thus far. If it is going to move in that direction, we have not heard about that from the OPLC. There's requirement to create a new application from scratch with none of the information that has been previously obtained. As well, there is a requirement that the program director for that particular resident or fellow complete a signatory saying that they are still in good standing within their training program. So we have to obtain both that from the program director as well as the application, as well as a $50 check. And I will make a little bit of a joke here, but it's true. Residents don't know what checks are. We honestly now...
I believe you, 100%.
They don't. They don't understand checks, and they don't understand how they get a copy of a voided check to be able to get a reimbursement. So we will be very hopeful that the OPLC, when moving to the process of having an electronic system, will allow for credit card or ACH to be able to allow them to pay that in a timely fashion. That has been a holdup for us over the last number of years, including this year with renewals being done. because literally they've never seen one before.
So just for clarification, the resident is paying the renewal fee, not the hospital.
The resident pays the renewal fee because the OPLC will not, on the board before it, would not have allowed DHMC to pay for all of the licenses that were necessary. And instead of cutting one singular check for each of the 120 to 140 people per year that needed to be renewed, they'd required to have a singular check go with each application, connected to it so that they could, do their processing. Then the resident provides us with a voided check or something from their bank showing that it was paid, and then our accounts payable office will reimburse them for that fee. To the point about the cost, you're right that if we stayed at the original level of $50 per renewal, it would be approximately $9,000 a year that DHMC would pay, which is not a significant amount of money, and yet we'd rather not pay that money if we don't have to.
I don't want you to either.
And put it towards education and other things like that. At least in the GME realm, that's what we're most concerned with. We have not heard the idea that they would maybe decrease the fee to $25 or to some lesser amount. What we would be, of course, very thankful for them to be able to do that.
So just for your peace of mind, I've talked to the director about it specifically, and she was already in the space where they would do that, but I will insist that they do that. So
Great. That would
it
be
shouldn't
helpful.
create a larger financial burden for you or the doctors.
Understand. The other piece around what the administrative burden would be with regards to your calculation of approximately 1 day per year that would be necessary for an administrator to do this work. There's a variety of confounding factors that go along with that, where I would disagree with you as to the amount of time. One of those things has to do with the number of visa holders that we have at our organization who need ECFMG status and other kinds of requirements in terms of upkeep of their visa to allow them to continue to work at DHMC. So we have very specific regulations we need to follow with regards to those processes and the licensing that takes place. So that is a more extensive process for visa holders. In addition,
Just for clarification, you only have to do that if the license is being renewed. You don't have to do that on a regular basis regardless.
at the renewal time, we would need to be providing that information to the ECFMG to maintain their status as visa holding resident trainees.
Right. So I'm saying
Anytime we renewed.
Okay. So if it's 4 years, then you only have to do that every 4 years. If it's every 2 years, you're going to have to do that every 2 years.
Exactly right. And also to your point earlier, and I don't know how much everyone knows about what the training process looks like for residents and fellows. We train people from 1 to 7 years, depending on the length of training. So a neurosurgeon gets 7 years of training, and someone who is in a preliminary year in surgery gets 1, and then goes on to 4 additional years of training. So we are looking at a difference between renewing people every 4 years, which most people would get done within that 4-year period of time. Most residencies are 3 to 5 years long, and instead moving it to 2 or 3 times that we would need to renew people. Additionally, the way that the board at the OPLC has put this forward to us is that when a resident applies for their license, so right now people are applying to start in June when they start with us for our June orientation, and July, their license will become effective. Let's say if I send in my license and the OPLC approves it on April 15th, it will be good for 2 years to April 15th of the following year. The previous way that licenses were being done was that they would all expire on June 30th, let's say, of every year or every other year for people. So what we're going to do is have this continual update and tracking of all of the individuals at the time that they are actually receiving their license, as opposed to having a standard license date. So to your point of whether it takes 8 hours for someone to do that work, it would definitely take them longer than that, but it would also be spread over a period of time in order to meet all of the timing needs and to get each of them through. Because we definitely do have people who begin, about half of our residents and fellows start in July, half start in June, and then we have people who are off cycle as well. All of this is just to say that there is some nuance to the way in which this is done in the resident population. Finally, I would also note that they are contracted to work at DHMC for the entirety of their training. If they choose to leave because they want to relocate to another place, or they've chosen to move into a different specialty because they're not a competent clinician in a particular way, but they could be in a different, I lost my train of thought.
If they leave, they're going someplace else.
If they have to do that, Sorry, totally lost my train of
Do
thought.
something with the license renewal, or their license status would change, or
While Chesley grabs for that thought, where I went, where I thought she was going with that thought is that, yes, residents obviously train at the medical center, but residents are also placed throughout the state. So at Concord Hospital, Portsmouth, elsewhere, at other locations. So are residents truly training the workforce for the state and region, not just for the Lebanon, Hanover area?
I think that the thing we're most concerned about really is the opportunity to be able to work directly with the OPLC on a process that works well for this particular group of individuals who are contracted to work in one place, who are not required to provide CME like a regular attending physician would be, and who really, if they leave our employ at DHMC and move somewhere else, they no longer can have their training license at all. And so we're really tied to them, and they're really tied to us with regards to these processes and ensuring that they have their appropriate licensure in place at all times. Because if they were to have a lapse, we would immediately move them out of clinical work until they had that license renewed. That is a thing that I am particularly concerned about with regards to the resident being the responsible party, which is what the OPLC has told us in the past. Is sort of different than what you've spoken about today. They really told us that we could no longer help in that process in any kind of real way. We could, in the background, obviously provide reporting to programs and to residents to remind them that their license is due to expire and they're going to need to have it reapplied. But the actual fact of needing to have them reapply every 2 years, there really isn't anything that is going to change about them within that period of time. The difference between a 2-year or a 4-year renewal is, to me, I understand it from the idea of having all licensure across the state wanting to be standard. And yet at the same time, this is a group of apprentices, honestly, who are contracted to work with us. And there is nothing that's changing about their status during that 2-year period of time. If it did, when a resident leaves early, our office communicates with the OPLC to say that person is no longer in our employ and no longer can have a license. So the piece around 2 versus 4 years to us feels arbitrary for sure.
well, let me ask you. Well, actually, any questions from the subcommittee before I ask a question? Okay. I understand that the status isn't really going to change from 2 to 4 years. How does that differ from when they're a fully licensed physician, though? Because that's really not going to change from 2 to 4 years either, will it? Other than that's just when the state is requiring that they renew their license.
I would argue that as a fully licensed physician who does not have to require supervision from any other individual in order to do their job, there is risk there that the state is taking on with regards to the licensure of that individual, and they do require the continuing education that needs to be provided to ensure that they are continuing with the depth of knowledge that they need within their specialty in order to continue to do their job. So there's a different level of risk that the state is taking on with regards to a full-time attending physician who can leave the employ of any place they want and move and work anywhere in New Hampshire, as opposed to a resident who is under supervision from an attending physician and who is contracted to work directly at our organization.
Great. Thank you for the clarification. I appreciate that. Just checking in. Any questions? You good? You're good? Let me think for a second so that I can make sure I cover all my bases. So you did mention that OPLC has said to you that the resident physicians will be responsible for their own licensure renewal.
Yes.
And well, first I wanted to clarify from a mathematical perspective. I was saying only one more license renewal than you would have otherwise had to do, because OPLC, and you can tell me if this has been different from your experience, said they never renew for more than 4 years, for 4 years.
Previously, that was correct, yes.
Right. So if it was going out 7, they still would have had to renew at 4.
Correct. Anybody 4, 5, 6, or 1 day over 4 would be required.
Okay. And also clarification from what I was saying before. I was the mathematics of 8 hours or a workday was just to simplify. Obviously, I didn't think that they were all happening on one day and it was just going to take one
Understand.
person. But so that's falling on them to renew their own licenses.
Correct.
Which previously, before the changes that we've been making in OPLC, was not the case. You were just able to do the whole thing yourself.
Correct. There wasn't an actual, we could communicate directly with the OPLC and provide a letter that said these individuals are continuing on in their training as they had received previously, to know the start and end date of training as soon as the application went through, to say, yes, confirmed, these people are moving forward, and they would extend their license. So it was a very simple process that fell in line directly with the initial application and the length of training you expect somebody to be in based on the specialty in which they're training.
Okay, and just one more clarification, and I think I'm good. You had mentioned, because you have a lot of international people working for you, there was other paperwork that you had to fill out during a renewal cycle, and that goes to who?
The ECFMG.
Yes. Can you give me the words that go with the letters?
I
or-
actually don't know.
Oh, okay.
The person in my office who manages that knows it all inside and out, but I can get it for you.
Okay. Yeah. Just and so that's outside of the state licensure protocol. That's totally separate.
That's federal.
That's federal. Okay. But the federal bases it off of the state requirements?
It's not that there's a federal license, it's just that there's requirements with regards to visa holders in terms of what they can and can't do when they are in training in the United States. And so anytime there's a change to anything that has to do with them, we have to contact the ECFMG to make sure that they are aware of that, because they're looking at their visa status when they go home to, let's say, India for a 2-week vacation to see their family and come back. We have people who get stuck in India trying to come back home. So there's requirements around any visa holder and how they can train, where they can train, what their license looks like, et cetera.
Okay. And your average time that you feel like it takes out to do that for a person, just average. I know it's going to be more for some, less for others, but
I guess I'd give it an hour.
Okay.
Per.
An hour per. Thank you so much for coming in and testifying. I appreciate that. Anything
you.
else from you guys before we?
No, I was just going to say thank you for the opportunity to speak to the subcommittee. Appreciate that. Realize you don't have to do that. And then with respect to the hearing, you're going to hear the similar information, I assume, but presume that that's the information you're looking for to inform the.
Yes,
our position
absolutely.
on this
And
bill.
I'll follow up with Director Courtney. They should be here for. We have a hearing at 10:15 or 10:15 on an amendment for this bill that has to do with the medical board. So I can just check on some of the concerns that you had in that time period as well, because we will be execing this bill later today. So I got to make sure that I have all those ducks in a row.
I'm sorry, did you say you were or were not going to be?
We will
executing?
be executing today on this bill. So
Okay. Thank you.
Yep. So I appreciate you coming in and helping us out. Yep. Thoughts?
That changes the situation a little bit, so, and Representative Fitzpatrick, hear from some of it, not hear from all of it, so we need to brief you on that as well.
All right. Representative Boyd, any thoughts? Okay. Well, I'll definitely follow up with Director Courtney and verify some stuff so that when we talk about it later this afternoon, we have the information that we need there. Yeah. I think what I'd like to do is look at the amendment briefly with you guys so we know what that's about going to committee. At the moment, you just want to leave it without recommendation while we finish sorting things out, and we can just discuss it with the full committee.
I think that's,
I'll make that motion without recommendation. Do I have a second? Peter, all in favor? All right, we'll go without recommendation. We'll talk about it with the whole committee then. There's an amendment, SB 371. We'll have a public hearing on this in a little bit, but I just wanted the subcommittee to have a bit of a heads up on it. We've been restructuring the different boards in OPLC as we move responsibility from the board to OPLC for certain functions. And so we hadn't done that with the licensing and regulation of physicians. And so most of this is language changing, moving things from the board to the office like we've done with all the other boards. There were a couple of things in here that changed. Page 3. line 25. And we may need to do a floor amendment to this language here as well to fix it, but we wanted to make sure that even in these courtesy licenses that can be given for 100 days, that the license that's held by the individual is substantially similar to the requirements that New Hampshire has for their licensing, which my understanding is it's pretty much the same across the board regardless. But I felt more comfortable having that, that in there. Following down on 33, we're just connecting the renewal process to 310.8, which is what we've been talking about. It's the every 2 years and all of the requirements that we have that keep it consistent with everything else. But instead of delineating it in its own language, we're just tying it to what we've already put in statute, just to keep it simple. And I suppose too, so that if it changes, it will change with it. We don't have to change each individual thing. I think those were the main ones. So once again, we'll have a public hearing on it so you guys can hear about that, but figured we'd get that work done this year so that we don't have to do it in some sort of subsequent year since we're knee deep in it already anyway. We'll just throw this on to 371. Any concerns or thoughts? It's pretty straightforward. All right, well, we've got a public hearing in 4 minutes, so I'll adjourn the work session. Thank you for your time.
Good morning. I'm opening the public hearing on Senate Bill 302, and I call the sponsor, Senator Rosenwald.
Good morning. Thank you, Madam Chair, members of the committee. For the record, I'm Sydney Rosenwald, and I represent, with honor, I hope, Senate District 13 in Nashua. I'm very pleased to bring you Senate Bill 302, which will make it easier for New Hampshire patients to have telehealth appointments with their physicians who are located in another state. This issue was brought to me by a constituent last year. His wife is being treated by a group of doctors in Boston whom they like and know well. My constituent sometimes has interim telehealth appointments on behalf of his wife. But because the doctors practice in Massachusetts and don't have a New Hampshire license, my constituent has to be physically located in Massachusetts to talk with them. He sometimes is able to borrow a room at a public library, but the Wi-Fi is not good and he often gets kicked out. Sometimes he sits in a parking lot and talks on the phone, but he has to be physically located in Massachusetts. This just doesn't make sense to me. Technology doesn't stop at the border. And as I've spoken to people at OPLC, the Medical Society, and at the Department of Justice, and also last spring I spoke with the chair of the Board of Medicine, it became clear that a simple, very limited licensing exemption would be helpful to New Hampshire patients. So this bill exempts an out-of-state physician from needing a New Hampshire medical license only when they have an established relationship with the patient in the physician's home state of licensing, and they see them in person at least once a year, but as often as the patient's condition requires. This way, people can have video telehealth or telephone appointments with their doctors who practice elsewhere from the comfort of home and not have to drive over the state border and sit in a parking lot. I think it's a common sense bill. It's very limited. It was very carefully crafted to be extremely narrow, but I think it will help a lot of New Hampshire patients, and I hope the committee will find it ought to pass. Thank you. I'm happy to take questions.
Representative Mangiaputi.
Thank you, Madam Chair. Thank you, Senator, for taking my question. Going from the New Hampshire physicians doing telehealth in Massachusetts, or Massachusetts physicians doing telehealth for patients in New Hampshire. Is there a reciprocity like New Hampshire physicians seeing Massachusetts patients, just especially in Nashua, the border across the street, across the border. And I have been asked several times from the physicians in New Hampshire, they cannot treat. They can treat the patient when they come to New Hampshire hospital or their practice, but telehealth across the border in Pepperell or Dunstable is not allowed. So it's the similar situation. Have you considered that with that?
Yeah, well, and that situation is particularly acute across the river from Dartmouth to Hitchcock, where 40% of the patients live in Vermont. Unfortunately, we cannot control how other states license their physicians. Massachusetts has not joined the Physicians Compact. They've considered it, they haven't done it. If they did it, it would make it easier, but we are only able to control what happens in our borders. So we just can't do what you're suggesting, which a lot of physicians would like to see happen.
Follow up.
Thank you, Madam Chair. The follow-up too is, from what I understand, the federal licensing for physicians, New Hampshire doesn't belong to that. And so, New Hampshire, you have to get medical license in New Hampshire, whether you have in other states, and reciprocity is a cumbersome process. Would that make it easier? Just a question that I'm asking.
I think you're referring to the Physicians Compact. New Hampshire does belong to it. Massachusetts doesn't. I hope they will join it.
But if
But
Vermont,
this could apply to somebody who has a procedure out at the Mayo Clinic in Minnesota, wants to have a follow-up appointment with the physician who did the procedure. This means they wouldn't have to fly out to Minnesota. They could have a telehealth appointment. So this is a small thing, but I think it would be a big thing for the comfort and ease of New Hampshire's patients without jeopardizing health and safety.
all right, thank you. Other questions? Thank you, Senator.
Thank you very much.
Okay, just Escalent.
Good morning, Madam Chair, members of the committee. For the record, my name is Jessica Eskeland. I'm the Senior Public Policy Manager for the Alzheimer's Association here in New Hampshire. I am pleased to appear today in support of Senate Bill 302 and thank Senator Rosenwald and the sponsors for their leadership on this issue. As you've heard, as we all know, there is a healthcare workforce shortage in New Hampshire. For example, affecting our demographic in 2021, there were just 33 geriatricians in New Hampshire, compared with the over 26,000 Granite Staters living with Alzheimer's disease. This makes it really hard for folks to receive specialized care in state and has necessitated a lot of the folks that we serve to establish provider relationships over state borders, oftentimes in Massachusetts. And as you've heard, accessing these appointments via telehealth can be difficult. This is causing, again, as you heard, folks to take telehealth calls in parking lots over the border or look for a quiet place in a library, which is often unreliable and not necessarily private. So by making this small exemption in law, we really feel that this would benefit and remove what we see as an undue burden on not only the folks that we work with who have Alzheimer's or other dementia, but also their family members and caregivers who are often a part of the logistics of getting them to these appointments where they need to be and are often juggling other life responsibilities, employment, childcare, et cetera, whatever they may be. So this small exemption would allow these folks to access the specialized care they need, but from the privacy and comfort of their own home, and free up some time that could be otherwise spent managing other responsibilities that they have. So we would ask that you support this legislation, and I'm happy to take any questions.
Representative Gould.
Thank you, Madam Chair. Thank you for taking my question. And I apologize, my mind was wandering a little if you already addressed this. But my question is, would this measure make treatment more affordable for some patients? For example, the example we got about having to fly to a faraway place where you've had treatment for follow-up.
I mean, I would think just pragmatically, you know, the costs associated with travel, whether it be gas or mileage or airfare. I could see it certainly cutting down on that. In terms of the costs of treatment, I wouldn't be speaking to that, but I do think it would help defray associated costs just with travel.
Thank you. Representative Schmidt.
Thank you, Madam Chair. I should have asked the senator this question as well, but perhaps you can answer. Is there any objection to this on the part of the medical community or other stakeholders who would be in some fashion harmed by this small exemption, which clearly would be beneficial for the patients and helpful to the practitioners as well? So has there been any pushback?
I would defer to the senator on that. I have not had any conversations indicating that, but I would.
No.
Thank you.
Thank you. There's also only speakers in support, so we're.
Thank you.
Representative Manchacuti?
Thank you, Madam Chair. Quick question in terms of the Alzheimer's patients that you referred to. Wouldn't this help them with the transition of not leaving their comfort zone wherever they are because of their state of mind? And if they are in a Alzheimer's care in Massachusetts, they can still get their care from the or the vice versa. If they have moved closer to the family in New Hampshire, but they were getting care in Massachusetts by the physicians, they can continue to get, not having to transition everything, location, care, and family support.
Yes, I would very much agree with that.
Okay, thank you.
All right, thank you for your testimony.
Thank you.
Carrie Dennis? Oh, you just turned that off. There you go. Thank you.
Thank you. Thank you for having me. My name is Carrie Dennis. I live in Auburn. I have early stage or early onset Alzheimer's, and I am here to testify in support of Bill 302. When I began noticing problems with my memory, I brought my concerns up with my primary care doctor. He referred me locally to have a cognitive test, which I passed. He told me I was fine. It would be a conversation I would have several times over that next year. During my final meeting with him, frustrated, he told me that if I had Alzheimer's, I would have no idea, that my family would bring me in because I would have no clue where I was. Anger aside, this doctor did not have the experience or the expertise to be able to diagnose Alzheimer's, especially early onset Alzheimer's. Fortunately, I worked for a company that had the benefits of something called an expert medical opinion. It recommended that I go to one of the research hospitals in Massachusetts. I have been working with Mass General Hospital for almost a year. And because the law requires me to be in the same state as my doctor, I have to be in Massachusetts every time I speak with him. In one of my visits, I had received a test result over my e-chart. And I sent him a message, and he wanted to clarify and explain and help me to understand what that diagnosis meant. And the fastest way to do that was through a telecall. Unfortunately, it meant that I had to drive to a parking lot in Massachusetts to have that conversation. Driving to Boston is very difficult for me. My husband takes time off from work with each visit. I had 8 appointments last year. 3 of them could have easily been telehealth appointments. This diagnosis has been hard. And not getting to my doctors in Massachusetts for the quality care that I need is not going to get any easier. Having access to meet with my doctor that I trust and have a relationship with is a huge benefit for me and my husband. Please support this bill. And thank you so much for taking the time to hear me.
Thank you for your testimony. And okay. Leah Farley?
Good morning, Madam Chair. My name is Leah Farley, and I live in Hopkinton, New Hampshire, and I'm here to testify in support of Senate Bill 302. I've been diagnosed with younger onset Alzheimer's as well. Due to the shortage of neurologists and other healthcare providers in New Hampshire, I get medical treatment at Mass General Hospital Memory Care. Because of the current constraints on physicians under the current law, I'm required to travel to Massachusetts for every appointment, even telehealth to access care. This is a burden to me as well as my spouse, who still works. I had to close my business, and we have half the income now, so his job's very important for insurance and just living. So in order to join me, he has to take time off of work. He could get a conference room and do it from work, but he has to take time off. It's at least a half day every time we have a meeting. And then we end up in a parking lot or somewhere with poor Wi-Fi. Sometimes it's in and out, and it's uncomfortable, but it's the best that we can do right now. We'd like to be spared this burden, and it would be one less thing on our plate. So, having the diagnosis is challenging. It would be so helpful if accessing care was not one of the challenges. I respectfully ask that you support this bill.
All right.
Thank you for your
Thank you.
consideration.
Representative Manchacuti?
Thank you, Madam Chair. Thank you for taking my question. First of all, thank you for coming and sharing your testimony with us. Are you enrolled in any study that would require to go work can be accessed through telemedicine, because this is a research center and you have access to new research and new methods of treatment? Are you enrolled? Would that help? This bill would help for you to get engaged in those specialty studies.
Yes, I'm not currently. I was just diagnosed in June last year, and it rocked my world. And I hadn't gone any further. I'm just now through the Alzheimer's Association getting the support and information I need to know that there are hopeful things I can do. And it would definitely take away that barrier. I can't drive in Boston. Everything I do requires me to have somebody take me there. So thank you for thinking of that. Yeah.
All right. Thank you. Thank you for your testimony.
Thank you.
Susan Elberger? Oh. You should have indicated you were a rep. I didn't know that.
Bottom.
What?
It says on the bottom.
Oh, well. Told you sooner.
My apologies for that. Thank you, Madam Chair. Thank you, esteemed committee members, for allowing me to tell you about one of my constituents, and it's the couple who Senator Rosenwald mentioned at the beginning. I think all of us have constituents who touch our hearts in different ways. When we go out campaigning, we say, "What are your concerns?" And they say, "Let me tell you a story." This is a story. Ray and Caroline, which are not their names, have been married 48 years this week. Caroline was diagnosed with Alzheimer's 15 years ago. They were planning to come themselves and testify until Caroline had to be admitted to a memory care unit in February. And Ray is meeting with the doctor this morning. So he asked me to testify for him and said, "Please tell my story." So I will. Prior to the pandemic, there was no problem with a phone call. During when Caroline was getting her care in Massachusetts, prior to the pandemic, there were no problems with phone calls. During the pandemic, when telemedicine became a major advantage for people who couldn't travel, that was fine. And then after the pandemic was over, he was told that he needed to drive to Massachusetts with the spotty phone reception, the conversations in libraries, which are public places. At the same time, he was a full-time caregiver, which meant that he had to get respite care for his wife so he could go and make a phone call for her. He did not want to have to leave her, but he did. It was the only way he could take care of her care. A few months ago, the reason that she is now in a memory care unit is that when they went to bed one night, she was afraid to go to bed with him because she didn't know who he was. This is not a unique story. This happens to many of us as we get older. I'm the same age as they are. And I worry about this. We owe it to our constituents to not make their lives unnecessarily difficult. So I encourage you to support Senate Bill 302 to avoid this kind of thing continuing to happen. Thanks.
Thank you. Thank you for your testimony. Matthew Hoveld? Or something like that.
Hi, Madam Chair. For the record, Matthew Hood, Vice President of Government Relations at Dartmouth Health. My writing was a little quick, so you might not
Yes,
have seen it.
doctor, we understand that.
No, not a physician. Government relations, just to be clear. So I'll be very brief in my testimony. As you've heard, telehealth served an incredible role during the pandemic, and there was tremendous flexibility across state lines. Dartmouth Health, as was noted, 40% of the patient care that's provided in the medical center in Lebanon is for Vermont residents. After the pandemic and those flexibilities went away, we went back to the state that was discussed, which is you need to be the physician in the state where the physician is resident, or the physician needs to be licensed in other states. We certainly support expanded capacities via telehealth. We would love reciprocity. I want to go on record as saying that would be nice to have from the state of Massachusetts. In Vermont, what they have done is they are a compact state, so a physician could be licensed in multiple states that are part of the compact. They also have tiers. If you're going to do telehealth under a certain number of cases, you get a certain licensure. If you're going to do telehealth on a larger scale, you get a different license. Or you could be fully licensed in that state to treat all patients. So I just wanted to provide that information. Certainly support the expansion of coverage, but would obviously love it if our neighbors to the south were similarly inclined.
Is Vermont a compact state?
Yes.
Okay, good. And for your information, during the pandemic, New Hampshire issued tens of thousands of physician licenses, I think to everybody in Massachusetts, Vermont, or Maine that asked. So they were licensed, but only for a temporary period. And most of them have chosen not to renew their licenses in New Hampshire.
And those flexibilities were capitalized upon, benefited on by Dartmouth Health and other New Hampshire-based providers in those states, Vermont, Massachusetts, Maine.
Okay. Absolutely. Representative Schmidt and then Manjaputi.
Thank you, Madam Chair. So we're going to make our decision based on what's right for New Hampshire, of course, but can you tell us how this situation is being handled on a national basis? Because telehealth is obviously expanding all over the place for obvious reasons. So what is it like nationally?
Well, as this committee well knows, licensure is a state-by-state topic. So the federal government currently reimburses for telehealth coverage, and that coverage expansion or continuation of telehealth coverage will expire and will need to be renewed at the end of this year, is my understanding. But I don't think, while there's been discussions on the federal level, I'm not aware of any legislation that has traction that would resolve licensure issues between the states.
And it's not just doctors.
So, I mean, I used to live I was born and raised in Illinois and in Chicago, as a matter of fact, and it's very, very close to the state of Wisconsin, which has significant population in Racine and Kenosha, just across the border. Gary, Indiana, is right close, right next to Illinois, to the south. Also, a lot of
Representative Schmidt, your question?
so the thing is, this is a situation where very analogous to what we have here, where we have a tremendous linkage between New Hampshire and Massachusetts, but where these ridiculous situations that we've heard from the other witnesses, having to drive across and sit in a parking lot, trying to get a connection with their doctor to fulfill that imaginary line that separates New Hampshire from Massachusetts in this case.
Yes, I would believe so.
Representative Mangiapudi?
Thank you, Madam Chair. Thank you for taking my question. Again, I'll ask you about the reciprocity. You brought that up. So our state of Vermont, Dartmouth doctors are treating patients across the border in Vermont, correct? Or the patient, yes. So you are the research center up north, just like Mass General is for New Hampshire South. I mean, in New Hampshire South. So the compact, it has to be both ways. So what is our avenue for building that compact? How would this help with the compact for New Hampshire to join?
We have joined the compact for physicians. It's been in place for quite a while.
Correct. It's that Massachusetts has
Right.
not. So how do we encourage our neighbors to the south to join the compact? Good question. I'm sorry, I don't know the answer to that. To answer I actually thought during the pandemic, when there was the tremendous amount of flexibilities granted, collaboration between the states, that might provide a window that we would see post-pandemic. We haven't seen that, so it is what it is.
Massachusetts does what it wants, and we don't have much control over it.
Right. Just to answer your initial question, a Dartmouth Health provider that's licensed in the state of New Hampshire can treat a Vermont patient who comes to our medical center. If that patient wants to be treated in the state of Vermont physically or be treated from their home via telehealth, our provider either needs to have a license in the state of Vermont or have dual licensure now that we're past the pandemic.
All right, thank you. Other questions? Thank you very much for your testimony. Is there anyone else who wishes to testify on Senate Bill 302? Seeing none, I'll close the public hearing and open the public hearing on the non-germane amendment to Senate Bill 371. We will be voting on Senate Bill 302 this afternoon later today with our other bills. Representative Simon.
Thank you, Madam Chair. I'll bring a pink card back with me when I come. So the amendment to SB 371 comes at the request of OPLC. It deals with the licensing and regulation of physicians and follows the same general outline of changing language that we've been doing all throughout.
Are there copies?
Oh,
of
there
the-
are, and they're right next to Madam Chair. I
Oh, okay.
apologize.
Thank you. Thank you.
Sorry, I was
So-
looking for mine. I didn't see
I did.
it.
Hopefully, everybody got the email. Did you get it? I did email it to the
I
committee.
glanced it at
So-
email. Okay, pass them that way and that way. Thank you.
Well, I did leave him at my seat, so you can only thank me so much. I appreciate that, Representative Schmidt. So you'll see a lot of the same language changes that we've been looking at in general, changing things from the board to the office where applicable. There were a couple of more substantive changes that I'd like to draw your attention to. Page 2, line 21. Where it used to say the board may, it now says the office shall waive the exemption requirement for any applicant who has satisfactorily passed all examinations and requirements to become board certified by the American Board of Medical Specialists or by the American Osteopathic Association. In talking with the director, we couldn't come up with a reason why they shouldn't automatically be exempted or a case in which they would not be exempted. And we didn't want to leave open the possibility for favoritism to somehow show up unnecessarily or for people to be treated differently unnecessarily. So they always have given the exemption. We didn't see why that word shouldn't be changed to shall, but the committee should be aware of it. Page 3, line 25. Courtesy licenses are given for 100 days. And I know that there'll be a comment about this later, but I just wanted to make sure that there was substantially similar licensing as is typical in our reciprocity statutes, in that even though they're only getting a 100-day license, that they should still have substantially similar qualifications to New Hampshire's licensing requirements. And then the other more substantive change is just down a little bit further in lines 34 and 35. Instead of writing in the board on a biannual basis for renewal of license, we've changed it in accordance with RSA 310A, which deals with that, but it's already in statute. So we're referring to what's already in statute. But those are the main changes, other than primarily language changes, or if I've forgotten anything, I'm sure the office will be happy to point it out to you. And I will answer whatever questions I can.
Don't see any.
Thank you.
Thank you very much. All right. Mr. Hood? Are you addressing the amendment?
Thank you, Madam Chair. With me is Chelsea Nolan, who's the director of our resident training program. We are addressing the amendment. I'll be very clear for the record. My name is Matthew Hood, Vice President of Government Relations at Dartmouth Health. Wanted to be very clear that we have no position on the amendment. Our strong opposition to striking the underlying bill is why we are here, because of the challenges in what the implications of a change or a lack of exception for residency trainees would require. So we're here to speak to that, and Ms. Nolan can provide the details around that topic.
Hi, good morning. My name is Chelsea Nolan. I'm the Director of Operations for Graduate Medical Education at Dartmouth Hitchcock Medical Center. I want to make clear from the beginning that Dartmouth Hitchcock Medical Center has 450 some odd residents and fellows, 52 training programs, and we're providing care across, again, as we've just talked about, into Vermont, where our residents have Vermont trainee licenses, and to be able to provide telehealth to the previous bill, as well as providing care across the Dartmouth health system and into the various clinics in our state. Additionally, beyond Dartmouth Hitchcock Medical Center training, there are also residents in training at Portsmouth, at Concord Hospital, and soon to be at Cheshire Medical Center in Keene. Our concerns with regards to this licensure change that has happened with regards to moving from a 4-year renewal to a 2-year renewal for all license types in the state of New Hampshire is that for residents and fellows who are essentially apprentices in training for a contracted period of time under which their specialty requires a certain number of years of training, from 1 to 7 years. This change, moving from 4 years for renewal to a 2-year renewal, means that we are having to have those residents go through a renewal process 2 or 3 times during their residency training. At present, the new changes that have happened at the OPLC require that the resident themselves create that complete that application, obtain the appropriate documentation from their program director, ensuring that they are still within good standing within their training program, as well as submit a $50 check, which I've spoken before about, which they don't really know what checks are any longer, to be honest, or a cashier's check. To submit that to the OPLC to have a renewal of their training license. What we are looking for at DHMC would be to allow our residents and fellows and the residents and fellows at Portsmouth, Concord, and Cheshire Medical Center to be able to have a renewal process that isn't as onerous to the resident trainee who works upwards of 80 hours a week in their specialty training. Previously, we've been able to work with the OPLC or the board before it to provide a renewal notice for all residents and fellows to have that change happen in an automated administrative way. The changes that have been made at the state level are going to require that the resident, or do require now, but maybe moving to an electronic system in which the resident themselves is responsible for creating or completing that documentation and getting it to the board in the appropriate amount of time. As you can imagine, these individuals are highly stressed, have a lot of responsibilities on their plate, and our office, as well as the offices at our other GME members across the state, are in support of all of the requirements that they have to meet with regards to Medicare and Medicaid, to all of their New Hampshire drug monitoring, to flu, et cetera, et cetera. And so we really want to be able to continue to support them in that work and not have it move to them as being the responsible party to ensure that their license is in place. That is the request that we are hoping that we can move forward with to have an exception.
Thank you. We will be discussing it. We can certainly choose to include the original content or not. That's up to our decision, but thank you for the information.
Thank you.
All right. Questions? I don't see any. Is there anyone else who wishes to testify on this amendment to Senate Bill 371? The OPLC. Yes. Director Courtney and Mr. Officer. Okay, yes, thank you. We'll take them.
Good morning, Madam Chair, members of the committee. Lindsay Courtney, Executive Director of OPLC. With me is Attorney Douglas Osterhout. We support the amendment because I think it's intended to clarify the legislative work that you folks did last year, and will make our jobs easier implementing it as we move forward. I just want to address the underlying bill. OPLC is certainly amenable to, at times carving out exceptions. We understand that it's not always true that one size fits all. But I do want to be careful that that the justification for an amendment to our licensure timeframes is not based on a desire to essentially not have the licensee be obligated to go through the process. A professional who has a license is responsible for maintaining the continuing competence. And if that is the justification, any licensee could make that same argument. And we feel it's very important that the licensee understand their obligations at the outset. We have many different license types with many different education levels. People in high school attending apprenticeship programs, people who have doctorates. And the message is the same, which is that it's your responsibility to maintain your license. So we're happy to work on language that I think would be amenable to all parties. But I think we would be concerned if we're carving out an amendment for that purpose. Be happy to answer any questions you may have.
Thank you. Are there questions? No, I think you've made your point. Thank you very much.
Thanks for your time.
Does anyone else wish to testify? All right, seeing none, I will close the public hearing. And we have an executive session scheduled at 11. I'd like to have a Republican caucus prior to that. So we'll kick everybody out except the Republicans, and then we'll come back at 11 for our executive session. Thank you all very much. All right. Thank you. Good morning, everybody. Welcome to our executive session. Before we get going, we are the lucky recipients of a Senate message. All right, we have House Bill 1456, which is on the Board of Taxes and Land Appeals. And the Senate decided to make it a 5-year term, as we discussed, but didn't actually make an amendment to do so. They also changed the removal process by citing the correct RSA that controls the removal process rather than duplicating the language. So I'm going to recommend to concur unless somebody on the committee wants to change my mind. But it sounds like this is perfectly harmless. It's been known to happen.
I said, don't anybody do that.
Okay. It's a very reasonable change,
Right.
and we shouldn't argue with them about it. We're gonna have enough fun arguing about some of our other things. All right. So Senate Bill 302 from this morning. Does somebody have a motion? Now you are all here. You should have a motion. All right. Representative Schmidt moved ought to pass, and Representative Gould seconded. Do you wish to speak to your motion?
Thank you, Madam Chair. So this seemed like a reasonable thing to do. Thank you.
Thank you. Representative Gould, do you wish?
I agree with Representative Schmidt, and yes, certainly my concerns are for the Alzheimer patients and less disruption in their treatment routines, and all of the testimony we heard. It was wonderful.
Okay, thank you. Anyone else have a comment? Questions? Representative Stewart.
Thank you, Madam Chair. I got so much stuff here. I need to get the mic closer. Yeah, so many of our, how shall I say, advanced care type of patients just about have to go to mass hospitals in order to get the care that they need. So it seems a reasonable thing to do to me.
Okay. Representative Manjaputi.
Thank you, Madam Chair. I would hope that this gesture will trigger the reciprocity to the south of where I live and the state south of where I live. So hopefully there'll be a collaborative effort for the betterment of everybody concerned.
Representative Manjaputi, I would strongly recommend you not hold your breath while you're waiting. Massachusetts has a lot of specialists, and they want to control the access to them to some degree. Anyway, anyone else? Okay. All right, in that case, the motion is ought to pass on Senate Bill 302, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santos Sasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Manjaputi.
Yes.
And the chair.
Yes.
20 yeas, 0 nay.
All right, the motion passes 20-0. Does anyone object to consent? Nope. Okay, good. We will put that one on consent. And Senate Bill 371, also from this morning, Representative Simon, you have a motion.
Yes, Madam Chair, I would like to move Amendment 2024-1671H.
Or second?
Second.
Okay. Do you wish to speak to your motion?
I would, but I presented it to the committee during the public hearing, so I would only be saying the same things all over again. So to save the committee time, I'll pass.
Representative Groden?
I have nothing to add.
Okay. Thank you. Anyone else? Comments, suggestions, questions? My goodness, everybody must be hungry. All right, in that case, the motion is to adopt Amendment 1671 to Senate Bill 371, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakes.
Yes.
Representative Bailey.
Yes.
Representative Santos Sasso.
Yes.
Representative Dolan. Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Manjapudi.
Yes.
And the chair.
Yes.
20 yeas, 0 nay.
All right, Representative Simon?
Thank you, Madam Chair. I'll move ought to pass with amendment.
I'll second.
Okay. Any further comments? Representative Simon?
Sure. So as written, this bill does replace the underlying bill, and the committee should probably be aware of that. It was it's a bit of a tricky bill as far as testimony was concerned. We had testimony this morning that conflicted with previous testimony, even from the same organization that was giving the testimony. So did some last minute juggling on that. The bill itself would give an exemption to the 2-year renewal process for licensure for resident physicians, physicians who are in residency, is probably a clearer way to put it. I have had another discussion with the director from OPLC. The way that the renewal process is going to be happen moving forward addresses many of the concerns, but maybe not all the concerns that Dartmouth Hitchcock had. But it's a one-page renewal form. It will be a one-page renewal form. It will be electronic. It will have to be filled out by the resident physician simply because it will be attached to an account specifically for that individual. It should take less than 5 minutes for the resident physician to fill out, and there should be an electronic form of payment attached to that website so that they don't have to worry about going out and getting checks, because as we've heard in testimony this morning, they don't know what those are, which there's a lot of truth to that. That should streamline that a little bit. I guess I still feel, and I want to assure everybody, I did look into it and have further conversation, but I still do feel that if we're going to give an exemption for licensure, it needs to be a little bit different other than, everybody's busy. And I do appreciate that. I do appreciate that. But it is not an onerous process. It does require some responsibility. I understand that. But not such to the effect that I think that it rises to the level of exemption from the 2-year process. So that's my recommendation.
Representative Grota?
Yes, I'd like to add that in addition to what Representative Simon says, the amendment brings these parts of statute in compliance with with House Bill 655, in that it does delineate the responsibilities between the office and the board and cleans up that language.
Okay, thank you. All right. Anyone else? Comments, questions? All right. The motion is ought to pass with amendment, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakes.
Yes.
Representative Bailey.
Yes.
Representative Santos Sasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Manjapudi.
Yes.
And the chair.
Yes.
20 yeas, 0 nay.
All right. Motion passes 20-0. Any objection to consent? Seeing none, we'll put it on consent. All right. Senate Bill 485. Representative Grote, you have a motion?
Oh, I do have an amendment. I'd like to move Amendment 2024 1610H to House Bill 485.
Is there a second?
Second.
Representative Brown seconds. Okay. Representative Grote?
Yes. So in the last, one of the tasks that the subcommittee had was to compare Senate Bill 485 with House Bill 1085 that we passed through this committee. And when we did that, there were two sections that were left over, the digital recognizable license and the fact that military occupational specialties could be included in this for boards that are not required under OPLC. And at the last, right before the last executive session where we were going to entertain that amendment, we found out from both the Department of Informational Technology and OPLC that digitally verifiable licenses are not something that we can quickly implement without technology investments. So the committee decided that we would take that part of the amendment out. So really what's left is what's in front of you, which is something that that doesn't conflict with the bill that we passed in committee and actually adds to the licensing for veterans who fall under professions that are not governed by OPLC.
Representative Brown?
I would, thank you, Madam Chair. I would just add this brings full circle the conversation we had to make sure that those boards that aren't under OPLC will be required to complete their rulemaking process for a crosswalk for veterans. And if you remember, we decided not to do that on 1385 because it was too late.
Mm-hmm. Yeah. Representative Mangiapudi?
Thank you, Madam Chair. If I recollect the discussion, it just highlighted the weaknesses or deficiencies in our systems, which is the basic infrastructure of software, hardware, digital technology that's currently available. And as a state, we are not there. So this would, if we had followed what the amendment, the bill suggested, we would not be, the OPLC and the departments could not, boards could not comply with it. So that, having said that, I would say, not take your eyes off or your foot pedal off the infrastructure, underlying infrastructure that's needed for 21st century so we can be compliant and join the rest of the world. Thank you.
Thank you. I think in this case, if we were to do it immediately, we'd be ahead of the rest of the world, which is one of the reasons why we don't want to jump in on it. Anyone else? Okay. In that case, the motion is to adopt Amendment 1610 to Senate Bill 485, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakers.
Yes.
Representative Bailey.
Yes.
Representative Santonastasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Grote.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould. She is left. Oh, okay. Representative Smith.
Yes.
Representative Mangiapudi.
Yes.
And the chair.
Yes.
19 yeas, 0 nay.
All right. Representative Grote?
Yes, Madam Chair, I move OTPA on Senate Bill 485.
And I'll second that again.
Okay. Any further comments?
I have nothing else to say about 9 lines.
Thank you.
I agree.
Anyone have comments, questions, concerns? All right, seeing none, the motion is ought to pass with amendment on Senate Bill 485, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santo Sasso.
Yes.
Representative Dolan. Yes. Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiapudi.
Yes.
In the chair.
Yes.
20 yeas, 0 nay.
All right. The motion passes 20-0. Is there any objection to consent? Seeing none, we'll put that on consent. Okay. And for the information of those with us, we will be doing Senate Bill 440 last. Senate Bill 488. Representative Simon, is that yours? Representative Lakis.
Sherry.
Oh, yeah, Representative Gould.
Thank you, Madam Chair. My apologies. I move ought to pass for Senate Bill 488.
Is there a second? Yeah, Representative Lakis seconds. Okay. Do you wish to speak to your motion?
Thank you, Madam Chair. This bill primarily cleans up some language around two areas. One is remembering and not opening my laptop here. One of them has to do with continuing education. That was just a change in procedure that had happened, and so it's important we get something in statute to allow OPLC to follow up with physician assistants who choose not to continue some national certification. And there's a second part to it that I would have to look up. I'll look that up.
Representative Lakis might be able to help.
Thank you. Right. I agree on the first part. The issue is to get the initial licensing. The physician's assistants need to have some national certification. They're not required to maintain it. That certification defines continuing medical education requirements, but if they choose not to maintain the certification, they have to be defined somewhere, and this has the board define them. The second part is that under the barbering, cosmetology, and aesthetics, physicians' assistants that were not, they should have been, but they were not included in the exemption. If it's part of the medical procedure, they can cut hair. So if you fall down and split your scalp open, they're actually not breaking the law if they trim the hair around it before they treat it.
The barbers and cosmetologists got and have a very broad scope of practice, and they're vigilant in enforcing it. So, okay, any Representative Mangiapudi?
I don't know if I should say that, but at least it'll be a very expensive barber or haircut if you're going to a surgeon or a physician assistant.
Yeah, well, that's only when necessary, I'm sure. Representative Lakis?
Yeah, and even then, they're only permitted to do it if it's part of a medical procedure. So you could still not go to them to have your hair cut, so, if that's all you were having done.
Yeah. The other thing is that this allows the board to define the continuing education requirements for physician's assistants, as many of the other boards do. And it needs to be they need to have the authority to do that because it's important. Anyone else? Comments? Okay. The motion is ought to pass, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santo Sasso.
Yes.
Representative Dolan. Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiapudi.
Yes.
In the chair.
Yes.
20 yeas, 0 nay.
Okay, motion passes 20-0. Any objections to consent? All right, thank you. We will do our best to make this House session on the 23rd no longer than necessary. House Bill 600, Representative Alekis? Senate
Yes.
Bill 600. my
Senate Bill
mistake.
600. Yeah.
Sorry.
I'd like to move to adopt. If you give me a moment, I'll get the amendment number. And everyone should have it. Amendment 1737H to Senate Bill 600.
I'll second.
We should speak to your motion.
Yes. So Senate Bill 600, for the amendment to have any meaning, we need to mention that recently, I guess in the last couple of years or so, there was registration or certification of pharmacy technicians, and there was the ability for them to be licensed was added, and that's additional training and responsibility. So I guess it was thought that if they're going to be controlled by the Board of Pharmacy, there should be a pharmacy technician on the board. So the underlying board does that, and I can talk to that when we get to the bill itself. In the original bill, there was an error that where it mentions who can be on the board, it only listed certified pharmacy techs and it left out the licensed ones, which are, so this amendment fixes that. The other thing is that the prime sponsor asked that we move the effective date to January 1st of 2025 for two reasons, which the amendment does that. One is that given the current membership of the board and when people are, their terms are going to expire, it kind of just lines up better. But the other reason is that because licensing of pharmacy technicians is quite recent, there are very few of them currently. There's others going through the process, and so this would provide time for there to be more licensed pharmacy technicians who could possibly serve on the board. And that's what the amendment does.
Representative Grote?
I have nothing to add. Thank you.
Does anyone else have comments, questions, concerns about the amendment? Seeing none, the motion is to adopt Amendment 1737 to Senate Bill 600.
Representative Simon.
Yes.
Representative Lakis, sorry.
Yes.
Representative Bailey.
Yes.
Representative Santo-Nastasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Grote.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiapudi.
Yes.
In the chair.
Yes.
20 yeas, 0 nay.
All right. Representative Lakis?
I'd like to move ought to pass on Senate Bill 600 with amendment.
Second.
All right. Second by Representative Gould, slightly ahead of Representative Grote. Representative Lakis?
Okay, in addition to what I said before, this bill, as I said, adds one pharmacy technician to the board. It also adds an additional pharmacist because it's a good idea to keep the number of people on the boards odd to avoid ties. And in addition to what I mentioned before on the effective date, that's really all it does.
Okay. Representative Gould?
Nothing further to say.
Okay. I'd like to mention that we would like to pass this bill because apparently the Department of Justice doesn't know how many members are on the board. And so this will clarify it, which is so helpful. All right, the motion is ought to pass with amendment on Senate Bill 600, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santo-Nastasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Grote.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Manjapudi.
Yes.
And the chair.
Yes,
20 A, 0 nay.
excellent. All right, the motion passed 20-0. Any objections to consent? Okay, we'll put it on consent. And I will like to introduce our substitute members, and I apologize for not doing it sooner. Representative Malloy is in for Representative O'Brien, and Representative Melvin is in for Representative Gerhard. All right. And on Senate Bill 373, I'm going to move ought to pass. Is there a second?
A second.
Okay. All right. And this bill changes the air leakage requirements and requires the Building Code Review Board to make an amendment to increase the number of the minimum number of air changes from 3 to 5. It used to be 7. There are some issues with going it as tight as 3, and the latest version of the Energy Code has 5 as the minimum required. So there is some science behind the number, and there are some issues with overly tight homes, mold, outgassing of materials that have caused a number of organizations such as the CDC to recommend against building homes that tight. And I suspect a lot of that is due to people that don't realize they've got to keep their ventilation running, or don't run their ventilation properly because they're used to opening the windows when they want fresh air and letting the house leak. So it's a change. And I'm convinced the Building Code Review Board did not consider this as thoroughly as they might, because it was all wrapped up in the debate on the Energy Code. They didn't want to pick one piece of the Energy Code. So that's why I'm in favor of it. Representative Brown, do you wish to comment?
Thank you, Madam Chair. I would add, there was very reasonable discussion about the extra cost that this puts into building a home, and the extra cost into the testing of the amount of air exchanges. If you don't pass, you have to test again. And I forget what that cost per test was, but it had 1,000 after it. So that's a part of I think a major piece of the concern for the builders was the cost of these staying at 3. Thank you.
Mm-hmm. Okay. Anyone else? Representative Goley?
Thank you, Madam Chair. I will not be supporting this, just for a reason of matter of principle as to how the process works. We put into process how amendments are drafted for the Building Code Review Board. While it didn't pass the first time around, we heard discussion amongst those members that were here who had testified that they would be willing to work with the individuals to get this through in the proper procedures and done. And I would hope that we would at least interim study this and let it go through the proper procedure to be brought forward to this committee, the way every amendment is done, and the way we all agreed that the process should proceed. And I think if we interim study this, we can force the hand that they get back to the table, do the right thing, and not bring a piece of legislation forward on behalf of a group that didn't get what they wanted the first time around. For that reason, I will not support the ought to pass, and I would hope we could interim study this, let them do the proper procedure, and come back. If it isn't done, I am more than willing to go forward with this, because I was one that stood out and said that buildings were being made too tight, and I agree with them, but I just, as a matter of principle, that they should follow the appropriate procedures. Thank you.
Thank you. Representative Simon?
Thank you, Madam Chair. Just because I can't help but debate with Representative Goley, it's too much fun. My argument is that this is the procedure. This is the procedure. It was decided at one point that the building code was just too expansive for this particular committee and the Senate committee to look at. in its entirety. And so we have given power to the Building Code Review Board to look over the code and make recommendation to the committee as to what ought to pass. But ultimately, always, it is our job to ratify that code. Ultimately, always, it is our responsibility to determine what goes into statute. And all code does go into statute. That's what we do when it comes before us every single time. This particular piece of the code was heavily debated in the Building Code Review Board. Most of the time when we get the code, it's unanimous, so it's easy to just ratify those things. This was not. It was heavily debated. They couldn't come to an agreement on it. And so somebody's brought us a piece of that for our consideration. And as I said to Mr. Sherman, who's the head of the Building Code Review Board, although it would be very difficult for this committee to wrap its head around every piece of code and do that well, we can certainly wrap our head around a piece of code and the implications of it and make a decision. They're still doing their job. I feel like we're still doing our job in that process. And I just don't want to see us abdicate that, or and I don't think this is actually what Representative Gully was saying, so I don't want to put words into his mouth. I just don't want to become a rubber stamping agent for the Building Code Review Board, where we agree with what they agree with and disagree with what they disagree with. And I'll close by basically saying, if in the presentation of the Building Code Review Board to this committee, we disagreed with something that they had done, this is exactly the process that we would take to remedy that. We would make an amendment, we would bring it back to committee, we would discuss it, we would pass it, because ultimately the process leads through the legislature. So thank you very much.
And I will mention that the legislature has made specific technical changes to the state building code repeatedly. The last one I remember was the arc fault outlets in the electrical code. We said, if they don't work for you, you can replace them. 15 years ago, we said we will not mandate sprinklers, and we will not let towns mandate sprinklers in single-family homes, because after consideration, we decided the cost and benefits didn't balance properly. And there have been other cases, but those two are firm. It is our job, not, as Representative Simon said, not just to agree with what the Building Code Review Board does, but to think about it, and if they left a piece out or didn't make an amendment, legislation is the way to change it. But anyway, anyone else? Okay. The motion is, Representative Gould has a comment.
Madam Chair, I wondered, regarding the bill, I support this. More ventilation. I don't like airtight houses. I also, though, have a proposal to add, I'm not sure if it's called an amendment or an addition to this bill.
It would be an amendment.
An amendment to take the language from House Bill 1252, which this committee and the full House passed, but it failed in the Senate, and add it to this bill.
Okay, and 1252 is?
That is to form a study committee for Native Americans in New Hampshire.
No, my motion was ought to pass. Her motion is essentially to amend it. Is there a second to Representative Gould's proposal?
I'll second.
All right.
I'm so sorry. Could I have a clarification? It's not to replace.
No.
No.
It's
an
this is just
addition.
okay. Thank you. Then I do second that.
I have the speaker and the clerk have issued ground rules for silly season amendments. Since this bill passed this committee, we can attach it to any other bill in our committee. If it were to be a floor amendment, it could be attached to anything at all, because it's passed the House. It is germane, but any other committee can't pick it up. It would have to be on the floor.
And I could add that this bill also passed the House, correct?
That's why it's germane.
Okay, all right, thank you.
Yes, it has passed the House, therefore it's germane to anything. We can do it in our committee. It could be done as a floor amendment, either way. All right, Representative Schmidt.
So I will not be supporting this motion. And the reason is that we overlooked a very important fact when we heard this bill. Okay,
Not really.
right? And that was that there were 40 people watching online. 40 people. And we did not, and we said, and the chair acknowledged this subsequently in the discussion, that we should pay attention to what the, not everybody's going to come to Concord, okay? But of the 40 people who are watching, the vote was 38 nay and 2 yay on this. And the people who were watching were a number of people who were indigenous people, members of the Native American Commission and so forth. And we were totally blissfully unaware of that because we did not pay any attention to it. And we need to start doing that. This is our opportunity to reflect what the people who paid attention to this bill and voted, if you will, online, said. 38 nay, 2 yay. So, and Representative McGuire and I were two of the people in committee who voted no on 1252. So we made a mistake by not being fully informed, and this is our opportunity not to make the same mistake again.
Madam Chair, may I speak?
Yes, Representative Gould, I'm sorry, I didn't ask you to speak to your motion.
Thank you, Madam Chair. Yes, this bill was something that was recommended after last year, a bill that that I put in for recognition of Native Americans. And this committee heard the bill, they heard the testimony, they were aware of some opposition and considered all the factors, and it passed, I believe it was 18-2. It went to the floor and it passed almost unanimously on voice. There were maybe 4 or 5 nays. So I think it's something that is very important. As I've said in the past, the experience is that we have no study committee ever on record for Native Americans. And while we can just go ahead informally, like we did after last year to form this bill, it leaves no record for the future for people to go back and look at what was the study committee's recommendations. So I would hope to have people's support. Thank you.
Representative Broda, you wish to speak to it?
I do. I'd like to correct my friend from Dover, because during the committee hearing and during the executive session, he mentioned this 38-2 vote many times. And I, for one, did not make a mistake when I supported this bill in the first time. And the reason why, and I was very explicit about this, that it was my intention to pass both the bill that had to do with the commission and this study committee, because I was not going to take sides on who was what, when, where. So I am in full support of this, of adding this. And if the Senate didn't agree, and I'm sorry that they didn't, but they either go together or they don't go at all. That is the way I feel about it, and I think that this is the best avenue for us to follow. Thank you.
Representative Lapkus.
Thank you, Madam Chair. So I was a sponsor of this bill, and at this point I'm torn. I do think it would be reasonable to pass this. I'm a little concerned about complicating 373 by adding this on. And I've been going back and forth on this. And I think on balance, I'll vote for this, and see what happens. Thank you.
Okay, well, I'll go on to say that I'm also concerned with affecting Senate Bill 373. And I voted against the study committee in the first place because this is within the scope. Anybody can study it what they like, and this is, I don't think we need any more formal study committees. Anyone else? Representative Schmidt.
Thank you, Madam Chair. So, the testimony in the Senate, and I was one of the people who's testified, but the chair of the Native American Commission was there. She was online, one of the people who voted against it online, one of the 38, okay? She was there, and several other former or current members of the commission were there, and they testified against this in the Senate. That's one of the reasons that the Senate committee voted ITL. And that one of the statements that was made was that the study committee that this bill would form is antithetical to the good order and discipline, if you will, of the Native American Commission. That was the testimony of people who are on the commission, including the chair, before the Senate. That's the reason, one of the reasons that they voted against it. So I think we're asking, and those are the people who are the experts on the indigenous matters, and we should not overrule them in my judgment. Thank you.
I'd like to mention that I have been informed that we can't actually adopt this until we have a formal amendment, which could be obtained this afternoon. So if we vote in favor of adding this, we will have to do that vote after we get the amendment, which should be quick since it has to be what passed the House. But
Madam
people
Chair,
should be aware of it. Yes.
can I just follow up on one more
Please.
comment? Thank you. I'd just like to say that in response to what Representative Grota said, my colleague from wherever she's from, that I would like to I'd like to agree that we worked very hard to make this a collaborative project, and that we had a member of the commission agree to work with, we all agreed to work together, and we did work together. Something happened. I don't know what happened. I don't want to speculate. I don't want to guess what people's purposes or motives were. All I know is we all came together. We all agreed on two bills being both passed and moving ahead. And then there was a change on one party, which I can't understand. But I really appreciate the opportunity to be able to get a study committee on the record, because some of this confusion and back and forth just makes things difficult. And when we can all come together officially under an official study committee, it will all be on the record, and there won't be he said, she said kind of stuff. So thank you.
Okay. Anyone else? Representative Brown?
Thank you, Madam Chair. So I would be really concerned about 373 being derailed. That's if that passes, that's a direct impact to the cost of housing that is good for the citizens in New Hampshire. So, Representative Gould, is there any way that this could be brought up next year? It could be, I'm sure, but would that be a problem? I'll reiterate that again. The 373 and the air exchanges and the cost of housing is really an important thing we don't want to lose.
Okay. Anyone else have a comment? Representative Manjaputi.
A clarification, Madam Chair. So even if we vote on it, we have to take an official vote once we get, which means this afternoon.
Hopefully we would be able to get it this afternoon.
Okay, because this is the last.
This is the last day that I have scheduled for this committee. except for a, something to deal with the interim study bills sometime in October. So it would have to be today.
Thank you, Madam Chair.
Okay. Anyone else have any? All right, let's take a straw poll on the idea of adding the content of House Bill 1252 to Senate Bill 373. Those in favor? All right, there are 11 in favor. Obviously, that leaves 9 opposed. Mr. Greenland, if you could arrange to get such an amendment drafted as quickly as possible, we will recess this until we have the amendment. Okay. Senate Bill 318, Representative Lekis.
Yes, as soon as I get, all right, I'd like to move Amendment 1780H.
I'll second.
Okay. You wish to speak to your motion?
I do. So, earlier in the year, we dealt with House Bill 1271, which changed a number of boards to advisory, made certain other changes. There were some concerns about some of those boards, and we ended up interim studying that bill. The intent for creating the amendment on this bill was to take certain things out of there. The Manufactured Housing Standards, Installation Standards Board, and the Board Examiners of Nursing Home Administrators, and change those to advisory boards. Another thing was that there's the existing advisory boards of massage therapists, and actually I've got it here. Anyway, there's 2 other boards that would be combined. They're already advisory boards, and that was at the request of those 2 boards. And basically that was it. And unfortunately, when OLS drafted the amendment, they left significant pieces out of, and they were supposed to take those pieces out of 1271, apply those equivalent pieces from the proposed amendment to 1271, and create this amendment out of it. Unfortunately, there were a lot of chunks that were left out, and I went through it, and actually I want to thank Doug Osterhout from OPLC, who I asked to review it, and he found those pieces. So anyway, 1780 is what the amendment was intended to be. And this replaces the entire bill. Actually, what I should say is the underlying Senate Bill 318 is on so the Social Work Compact. The language is identical to the House Bill 1190, which has already been passed by the House and the Senate. And so passing that again would not make sense. So the 2 boards, the Manufactured Housing Installation Board and the Nursing Home Administrators Board, the subcommittee went through those in a lot of detail and looked at the proposed makeup of the boards and made changes to that. The other changes in here are there's some that are the general cleanup of the language. Some of it was in HB 655 from last year. There's some of that. But the main point is to make them advisory boards. And then, as I said, get the names right. There's the board of massage therapists, and then the board of it's reflexologists, structural integrators, and Asian body work therapists. They're combined, and the new board will be called the Advisory Board of Massage Therapists, Reflexologists, Structural Integrators, and Asian Bodywork Therapists. And again, that one was at the request of those boards. The other thing that I took out of the original Senate Bill 318 is all reference to medical technician registration. So we had House Bill 1410, which got rid of that because it was not working. And that went to the Senate, and the Senate has decided that they want to retain registration. They recognize the issues that we saw. And as I understand it, they're looking at keeping registration for medical technicians, but get rid of the board and have the rulemaking and other processes just directly under the Office of Professional Licensing and Certification. So I took it out of 318 so it not conflict with what the Senate appears to be doing. And that's what this amendment does.
Representative Barada?
I'd also like to add that you might all remember the amendment to House Bill 1095 and how the language in this bill is in compliance with the language that we have in other boards now. So we should have most of our statutes by the end of this session aligned. And I think that's also very important. So thank you.
Okay. Anyone else? Representative Mangiaputi?
Thank you, Madam Chair. I remember the hours of subcommittee work on this and pulling apart pieces and putting it together. Thank you, Representative Lacus, for your patience on doing that together. And I do appreciate the fact that we are only looking at the boards that changed from regulatory to advisory upon their request, not force the others that did not want. We heard a lot of boards that did not want to become an advisory board for their profession. And I appreciate the fact that we were able to incorporate that with this. And also the point of that has been my pet peeve in terms of saying not the individual, but the office of the OPLC or the licensing board, putting as a body in responsible, not individual heading any organization. So I appreciate both those. So I will support this. Thank you.
Representative Schuett?
Thank you, Madam Chair. I just basically want to echo Representative Mangiaputi's statement as someone who opposed the original passage of House Bill 1271. I do appreciate Representative Lakis's work to take out the items that were objected to, and I appreciate his work, and I will be supporting this.
Okay.
Yeah,
Representative Lacus?
thank you for that. And I also wanted to thank everybody on the subcommittee. This was a lot of work getting through 1271, and everybody participated in it, and that was good.
Yes. I'd like to mention that it will also make the interim study of 1271 a lot easier because we've eliminated some of the non-controversial sections, and the interim study can concentrate on what the requirements are for the remaining boards rather than look at combining the massage therapy and the Asian body work. Anyone else? Okay, the motion is to adopt Amendment 1780 to Senate Bill 318, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santinosasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiaputi.
Yes.
And the chair.
Yes.
20 yeas, 0 nay.
Okay. Representative Lacus?
I'd like to move ought to pass with amendment for Senate Bill 318.
Okay, is there a second?
I'll second.
Okay. Do you wish to speak to your motion?
Given that the amendment replaces the bill and we discussed it, I don't think we need anything else.
Representative Barada? Okay. Anyone else? Comments, questions, concerns? Okay, the motion is ought to pass with amendment on Senate Bill 318, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santos Sasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiaputi.
Yes.
And the chair.
Yes.
20 yeas, 0 nay.
All right. Motion passes 20-0. Any objections to consent? Okay, we'll put this one on consent. On a roll. And that leaves Senate Bill 440. Representative Lakis.
I'd like to adopt Amendment 1815H to Senate Bill 440.
Okay, is there a second?
I'll second.
Okay.
So,
Lakis?
I mean, the underlying bill would allow optometrists to do some additional procedures. There was a lot of concern raised about them potentially doing it without adequate education, training, and all of that. And so that was, we had the subcommittee work session on it. I'd like to thank everybody who was working on that. And so there were some changes. I mean, the first part of this amendment is just a little bit of cleanup on the language on the list of procedures they're not permitted to do. As I understand it, this part was, there was agreement between the ophthalmologist and the optometrist. That's what I heard. And it's just some more like technical changes to the descriptions and names. The substance is on the second page, starting at I'm sorry, yeah. Starting at line 22. And it's the what the board has to do around rulemaking. And it says they shall have the authority to determine what constitutes a practice of optometry by persons licensed in this chapter consistent with curriculum of nationally accredited schools. But in particular, they must adopt rules establishing the credentialing certification, which shall be fulfilled before a person may be certified to perform ophthalmic procedures. And they're given a list of things they must do. One is identification and categorization of ophthalmic procedures for the practice of optometry. What we heard, and both in the public hearing and in subcommittee, is there's a large list of potential procedures. And so they have to group the ones that they want optometrists to be able to do, in categories. And then they have to establish the criteria for performing such procedures with proficiency. That's got to include minimum education, training, and live experience requirements for a person to perform such procedures with efficiency. There was concern expressed about optometrists potentially only practicing on inanimate objects, whether it's from animals or synthetic simulations, and and so this requires that they actually have live experience requirements. It also is criteria. It says for proctoring and criteria for acquiring such proctoring. In other words, when they're doing this kind of clinical work, when they're getting their practice on live patients, they're going to have somebody watching what they're doing, presumably as part of their training, and to make sure they're doing it correctly. So the details on that must be done in rules. And and then also on the next page, Roman 2, it says, no optometrist shall practice under this section unless the optometrist has submitted evidence of satisfactory completion of all requirements for specific procedures. And the office has certified that. And also a little below that in section 12, it makes it explicit that if a optometrist performed any of the procedures for which they had not been certified as having met the requirements, that would be a disciplinary offense, and they could be sanctioned for that. up to and including losing their license. And so, we heard concerns that, it wasn't clear, how they would get the training and all of that. And that may be true, but until there is a clear definition of what the education and training requirements are, and that's a process of rulemaking. So anybody can be involved in that. I expect both optometrists and ophthalmologists will be involved in that process. And we heard testimony from the optometrists that they intend to use as at least a guide or starting point for what the training and other requirements would be, training, education, all that, would be based on what ophthalmologists are required for those particular procedures. I mean, they wouldn't have all the training an ophthalmologist would have, but then again, their scope of practice would still be dramatically less than that of an MD. And so that would be, and until that is done, until the rulemaking is done, and until there are optometrists who have met those requirements, no optometrist is going to be able to do anything they aren't doing today. And so this is not letting all the optometrists loose as soon as this goes into effect to do whatever they want, but it sets in place a process to define what are the education and training requirements they're going to have to meet, including working on live people under supervision. And that's the key part of the bill. There's, if you look in on page 3, line 21, there's some technical changes similar to what we've done on other bills, and House Bill 655 last year, clarifying what's the responsibility of the board and what's the responsibility of the office. And those changes in that section were at the request of OPLC. And also the board will define the details on the requirements for continuing education. And so that's what this does.
Representative Mangiaputi?
Thank you, Madam Chair. Thank you for the detailed explanation, Representative Lakers.
Oh, excuse me. I'm sorry. Do you mind letting Arthur finish, or would you? Okay.
Oh, I was just speaking to my second. Okay. So what I want to say is that I want everyone to understand that rulemaking is not a joke. It is totally, it's an intense process, and that anyone who minimizes rulemaking or thinks that this is some willy-nilly thing that optometrists are going to be able to do, they're incorrect. So I think that people should realize that rulemaking is something that always happens as a result of legislation in things that, and it's very common in licensing. And this committee has supported boards and the importance that they have in their expertise. And we ask them to put that expertise in writing through rulemaking. So I don't want anyone to walk away from here and think that rulemaking is just going to be a couple of check boxes filled out and that's going to be the end of it. It's serious stuff. And I'm glad that it's in here. And I think that it's an important part of this process. Thank you.
Okay. Representative Mangiaputi?
Thank you, Madam Chair. Sorry for jumping the gun. Couple of things. For me, it's still, I've toiled with a lot of this about this bill, and I think echoing Representative Grota's points, that rulemaking has not already happened, and we are not just adopting something that's already been, proposed by one group or the other. And I still very firmly believe this will only enhance the opportunity for the granite staters to get preventive early intervention and access to eye care based on very solid grounds of what the training is, who's looking at it. And so I would, and it'll take a year or so to do the rulemaking and, working collaboratively. And I still firmly believe that this will remove the silos of this is my territory, this is yours kind of thing. It will definitely enhance collaborative effort. Thank you, and I will be supporting that.
Representative Goldie?
Thank you, Madam Chair. I will not be supporting this. We look at what we do here when we do licensing, and it's about public safety. And there was some discussion that only 2 schools in the country out of the 22 that do instructing have actual clinical experience required. And specifically, there was one here from Kentucky, when it testified, was asked what the minimum was that someone had to do to be considered proficient, or the maximum, and there was no answer. He couldn't answer that. So there's no guidance as to what proficiency means. You can say we're going to put it in rules, but there's no criteria out there with these programs. We are not the medical experts. We had folks sitting here on this committee from Health and Human Services, from the medical field. And one of them, Representative Murphy, I asked specifically last week at session how he felt about this bill, and he didn't even feel comfortable with it. And Madam Chair, with these folks were here for a reason, to get their input. And my question, I guess, goes to Representative Lickis. Was their input brought forward after the subcommittee met on how they felt about this amendment?
Representative Blackus?
Right. I did not talk to them specifically, and I wasn't contacted. However, there was communication with certainly a lot from the ophthalmologists and also the optometrists. And I mean, it's recognized there are limited places or schools for people to get this training at this time. But the concerns raised about that were certainly recognized, and I think addressed in this amendment. There's going to be input from ophthalmologists and whoever else is interested on the rulemaking, and they're charged to define what adequate training is, or what the proper training is for them to become proficient. There is a requirement that was added, partly in response to the concerns that were raised, that it include, live practice on people under supervision. And it may be that there are, not very many people who've come out of schools already, maybe nobody, who will be able to meet the requirements that end up in rules. But we've heard there are expansions in this because there are more states that are permitting some of these additional procedures. And if somebody's had the training but they haven't had the live practice, there are options. There may be, it's going to depend on rules, a situation where that optometrist would work closely with an ophthalmologist to get that clinical practice on live people under supervision with that ophthalmologist. There's a number of possibilities. And the expectation I have is that the number of optometrists that are going to be able to do these new things will grow slowly. But as somebody had said in one of the hearings, it's to some extent a chicken and egg problem. Right now, a lot of the schools are not providing this training because because the state where the school is, it's not legal for them to do it, so they can't, or because most states it's not legal, and so there's no point. But there's, as we heard, 12 states, and if New Hampshire might add to that, where some or all of these procedures have become legal. But it'll be a process of growth of the education or training requirement, opportunities coming to be. And we did hear from the optometrists on the board, who are actually on the board now, that the intent, at least as a start for the rules, is the level of training and including clinical work required of the ophthalmologist for those specific procedures. But as an ophthalmologist can do many other things on the eye, and in fact they're MDs and they can do any general procedure that medical doctors can do. They can under the law, under licensing. They may choose not to. But anyway, I mean, this sets the framework in place to set out the rules and requirements for the training, education and training. And as that training becomes available, then people will be able to take advantage of it. And if it doesn't, then optometrists aren't going to be able to do anything new. But unless we allow this opportunity, then that rest of that is not really going to be able to develop.
Representative Simon.
Thank you, Madam Chair. Two things briefly. First, not that the debate hasn't had to do with the amendment, but when looking at the amendment, my kind of opinion on it is, regardless of whether you share Representative Goley's concerns, the amendment is much better than the underlying bill at delineating those things. And for that reason, I think it's worthwhile to adopt the amendment and perhaps debate more fully the underlying bill. The second thing was just a clarification to something that Representative Leckus said earlier. On page 1 on the list of exclusions, I don't think that it would be a fair I don't think it would be fair to say that the ophthalmologists were like in support of the list. They're not really in support of anything. So what it is in the process of the conversation, some things were said. The optometrists took those into consideration, changed some of the language to strengthen it, to hopefully meet some of the concerns that the ophthalmologist had. Certainly, line 29J in particular. I can attest to having had a conversation with an ophthalmologist. That language around the orbit of the eye is much more acceptable and much more restrictive than the original language was. So it certainly does take his concern into account and change it to make it stronger. But I still have a feeling that if I gave it to him, he wouldn't stamp it and say, we're for it.
Okay. Representative Dolan.
Thank you, Madam Chair. My comment is for the underlying bill, not just the amendment. You want me to wait?
If you don't mind.
Okay.
Representative Schuett.
Thank you, Madam Chair. I'll make all my comments at this time. I will be voting for the amendment. As Representative Simon indicated, I feel that it does make the bill better. And I do appreciate concerns expressed at the hearing about access to care. However, I don't feel that the one very lengthy subcommittee meeting that this committee held was enough to dive into all of the procedures involved in this bill. And I would hope that we could possibly send the underlying bill to interim study for this process to further examine these very complicated issues. Thank you.
Representative Schmidt and then Brown.
Thank you, Madam Chair. Well, I certainly want to commend Representative Leckus for all the work you've done. And I think we are getting closer to where we need to get to. But I recall several years ago when we were dealing with an issue involving the disability community, and they came before us and very passionately advocated with one phrase that I've never forgotten. And it said, "Nothing about us without us." And they said about the bill we were dealing with at that time, it was something about them without them. And so this new amendment, I think, is a definite improvement. What I'm concerned about is that we are legislating over the top of the HHS committee, which has the purview of medical stuff. Our purview in portfolio is rules and licensing and so forth. And we are going in the right, definitely going in the right direction with regard to that. but we have some ophthalmologists. Have they seen this? I don't know. But I think that you said it a moment ago or a couple of minutes ago, Representative Lekis, that that you had heard from some ophthalmologists. You've heard about some of the things, and this gets more specific. But I think we have not had a good enough procedure or process yet. We're getting there, but I'm not ready to rush with something dealing with the human eye. It's one of our most important organs, most sensitive organs, and I don't want to do anything until we've had more subcommittee work on this amendment to see whether it gets there. So I will support this amendment because it makes the underlying bill better. That's for sure. But will I support the underlying bill, the OTPA? Not until I've heard from the ophthalmologist, because we have to have a collaborative practice with them as well as with the optometrist.
Representative Brown and then Lekis.
Representative Lekis may go ahead of me if he wishes to respond to it.
Thank you. First on what Reverend Simon said, I don't want to put words in the ophthalmologist mouth. Actually, I got that list from him after he talked to the ophthalmologist and optometrist. Probably a better way to say it is that they both thought that the changes in this list of what they shall not do was an improvement. Not that, that's what they wanted to see go into law. And, passing this bill, the amendment in the bill, isn't the end of the procedure. The question is, what would we do if we were to do further work? You said we're not medical doctors. Much of the HHS committee isn't either, although some are. And it would, coming up with the detailed rules on what procedures they may or may not do, what procedures, what the training would have to be for that, is I don't think within the expertise of this committee, just like the detailed rules of what the electrical code should be is not, or what it takes to be a licensed electrician isn't. What we do in general is we set up a framework and then we leave it to rulemaking. And I believe this bill does, with the amendment, it does a good job of that. There were some general kind of overarching concerns about optometrists doing things that they did not have the training for. I certainly wouldn't want them doing that. And this puts in requirements, including one that was raised quite a bit about, live practice. It puts that in as a requirement for the rulemaking. So it sets a framework in place for the rulemaking, and that process would continue, I'm sure, as a collaborative process between the ophthalmologist and the optometrist. And this list of what they may not do is just setting kind of a firewall, that even under the rulemaking and all that, they can't go beyond this point, which are more serious operations. So that's my take on it.
Representative Brown.
Thank you, Madam Chair. So originally I was very much against this. And then working through the subcommittee, and I'll thank our optometrists and ophthalmologists because there was a couple of interesting conversations in our subcommittee. It became really clear to me that I don't think that we as a committee, addressing Representative Schuer's comment, I don't think that I can answer in 7 years of surgical residency how many times has an ophthalmologist practiced with a scalpel on a live person? And is that particular practice, a general practice with a scalpel and or a laser, is all of that amount of time practice necessary to do X, Y, or Z procedure that they're asking to do? We don't know that at this point, and we certainly don't know the other side of that, as was already mentioned, that there's very little live practice in most optometric schools. So how long would it take this committee to understand that? It would take, I think, and would we get a consistent answer? So originally I was against this. I am now going to vote for it with the understanding from our subcommittee, I believe, that our optometrists are very much willing to make sure that any procedure that they're going to do meets at a minimum some type of surgical skill, general surgical skill, and then surgical skill with the procedure in general, or the specific procedure, excuse me. So because of that, I'm going to support the amendment.
Representative Smith?
Thank you, Madam Chair. I agree with Representative Goley. I'll get it. I'm not going to support this bill. What I would like to see what I'd like to see happen to this is to go to interim study. I don't think any of us are completely 100% understanding, and there are no guidelines as to how many times, like Representative Brown said, how many times they have done a particular procedure. Are they fast learners? Are they slow learners? We have no guides. I don't know how you get those, but I think until we do, we don't really have a good consensus as to what's going on here. And I will vote against it.
Okay. Representative Mangiapudi?
Thank you, Madam Chair. I just, having been on the subcommittee and having worked closely with the subcommittee members, I want to point out the reason I am looking at this as a step in the right direction is that both ophthalmologists and optometrists are professionals, right, with training, and both have the vote to public safety. And from what I took away from the public hearing was that optometrists are not running to hang their name out to say, I'm ready to do surgery. They're taking the process, also give us the opportunity to get in that direction, because the procedures and the technology has changed and the education is changing. So, and to adapt to that. And giving that professional courtesy, the rulemaking, giving them the direction. I'm not an ophthalmologist. I don't understand the details of it, but at least knowing that the board of optometrists, the board is willing to put the time and effort into set that rulemaking, keeping the public safety in mind and working collaboratively to get the help or support from the ophthalmologist. This is setting up that opportunity to work collaboratively. Having worked in the health field, I feel like, we've gone so much into the super specialty and gotten to a point where the collaborative effort has to come back to patient-centered. And with that in mind, I think this is the step in the right direction. We could study all we want. And how long will it take is the thing. So with that, I will be supporting this. And I just want to articulate that we are dealing with professionals and give that credit and respect. Thank you.
Okay. Representative Goley?
Thank you, Madam Chair. I just want to talk a little bit we talk about public safety as we go forward. And we've had a subcommittee meeting in 1 week to work on this. This isn't an easy subject. We heard from one of the schools that was here. There's only 2 schools in the country that give clinical experience going forward. We're talking about the rulemaking procedure and that no optometrist is going to be able to come forward right away with the experience needed to do these procedures. I don't understand why we are pushing this through today and not doing the appropriate work and bringing these two groups together, because I think there is some common ground on what procedures can be done in a safe manner. And why we can't interim study this, because it's been said numerous times, no optometrist is going out the door once this passes doing these procedures. So for that reason, I still will not vote for this, hoping that we do the right thing, do interim study, really look at this, see where the common ground is, and not rush this through. Thank you.
Representative Simon?
Thank you, Madam Chair. Just appreciating the full debate of the committee. As we head towards the vote, I just want to refocus a little bit and make sure everybody is thinking about the fact that the first vote will be on the amendment and whether or not you're for or against the underlying bill. If your concern is public safety, you still want this amendment. So I don't want that to get lost in the shuffle of the debate of the underlying bill. This amendment certainly does improve the bill overall, regardless of your position. So please keep that in consideration when you go to make your vote.
Okay. Representative Gould?
Thank you, Madam Chair. I'd like to thank Representative Lekis for his leadership on the subcommittee and all of the parties for coming to the meetings and sharing a lot of good information with us. Just like I talked about in terms of the chicken and the egg with the schools, you can't expect schools to develop programs with live results when it's illegal to do and when there's not a market for it because the states aren't allowing it to happen. I would also say you can't expect a bill to come forward here that where all the rules and everything's been laid out when we haven't even passed a bill to allow the process to get started. So again, we're talking about a chicken and the egg. And of course, it'll be the Department of Health and Human Services that has to do with the medical technical procedures. And I don't care how long we study it, that's not what this committee's role is. It goes beyond the scope of our committee to think we're going to get our head around what is the safety of medical practices. But to get our head around how you set up licensing and how you set up that process of rulemaking, I think we've looked at this enough to be able to make that decision. So I'll be supporting this amendment and I'll be supporting the underlying bill so that we can move ahead for the safety of patients so they can get surgery. Thank you.
I'd like to mention that the governor has decided as of yesterday to get involved in this, and he is encouraging the optometrists and the ophthalmologists to work together. If that were to happen and they come up with some revised language that is agreeable to both parties, I have committed to putting it into a floor amendment and bringing it to the House because we will be voting on this on the 23rd. If they don't come up to any agreement, and they haven't yet because they haven't yet met, well, we have to deal with what we have on hand. But I just thought you should know that there's a possibility of a floor amendment, which I will be sharing with the committee as soon as I know what it is. All right, anyone else?
Question of the chair.
Yes, sir.
So does that mean we are not going to proceed with a vote on this
No.
at this time? Or
No, sir. It means that we are going to proceed with a vote on what we have. I'm just warning you that the governor is meddling, and if the optometrists and the ophthalmologists happen to agree on something that they want to include in the bill, I will be bringing it forth as a floor amendment.
Thank you for that
If
clarification.
they do not agree, well, that's where we are now. But one never knows, they might.
Indeed, one never knows.
All right, anyone else? Okay, the motion is to adopt Amendment 1815 to Senate Bill 440, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santonastasso.
Yes.
Representative Dolan.
Yes.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
Yes.
Representative Brown.
Yes.
Representative Grota.
Yes.
Representative Schmidt.
Yes.
Representative Goley.
No.
Representative Schuett.
Yes.
Representative Malloy.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiapudi
Yes.
and the chair.
Yes.
19 yay, 1 nay.
All right, we have adopted the amendment. Representative Lekis?
Yes, I'd like to move ought to pass with amendment for Senate Bill 440.
Second.
Okay, Representative Lekis, second by Representative Gould. Is there any, do you wish to speak to your motion?
I mean, the concerns that we heard, I think, were, in my view, addressed by this amendment, at least to get the process in place. The only thing I'll say again is that, it is setting in place an ongoing collaborative agreement, which I'm sure the rulemaking will be. And, I don't, in considering interim study, I don't know what else we would want to do here. As Representative Brown said, we're not qualified to get into the exact details that the rulemaking would involve unless we're all going to go to medical school first. And I believe that's true also of HHS. I mean, I don't know if there's any ophthalmologists on there. Maybe there are, but certainly most of the committee is not that, or MDs. And so there's going to have to be a lot of drawn out discussion on the particular procedures. What are their training requirements? What are going to be the requirements for the number of live, clinical practice procedures and all that sort of thing. And I don't think an interim study, that's something that this committee could do, or any committee in the House could do. So I ask people to support passing this with the amendment. Thank you.
Okay, Representative Mangiapudi? And Representative Dolan then.
Unless the seconding person needs to
excuse
do.
me. Thank you. This has been going on too long. Representative Gould, do you wish to speak to your second?
Thank you, Madam Chair. No, I think Representative Lekis said it well.
Okay, Representative Dolan and then Mangiapudi.
Thank you, Madam Chair. My thoughts are that with an abundance of caution and public safety in mind with eye surgery, I'm in favor of restricting these expert surgical procedures to only qualified ophthalmologists, and therefore I will not be supporting Senate Bill 440.
Okay. Representative Mangiapudi?
Thank you, Madam Chair. I would support on two assumptions. One is that the rulemaking will happen. At least we have set that in motion. And also the fact that if this is not, it'll take a year or more for the rulemaking, there's an opportunity next term to put another concise bill to put more guardrails. So at least get the ball rolling so the collaborative effort can continue. So with that in mind, I would support the bill.
Thank you. I'll be supporting the bill, and I'll tell you, I want to go over three things that I think are important. Number one, our HHS colleagues did not come to the subcommittee meeting. And that disappoints me because they should have been here and they didn't come. Because we had a robust conversation, which they could have helped with, but they did not. Number two, as the healthcare landscape is changing. There's going to be more and more of this happening, where one profession versus another profession, there's going to be an overlap of those professions. We see it with nursing, we see it with physician assistants, we see it throughout the healthcare landscape. This is part of that. And that has to happen because there is a sweet spot within healthcare where someone is between 40 and 70, right? You're not chronically ill, but you're getting older. But that group of people is growing. And that group of people has to be given that healthcare, whether or not it's for whatever reason, whether it's less expensive to go to a mid-level provider. There's many reasons. Financial access is also access. That's number three. Number two. Number three, I really talk about myself. but I spent 40 years in business as a salesperson. I can read a room, and I can read people, and I am very good at negotiating. And I can tell you that the lack of negotiation takes two people, two groups. And really, I'm disappointed in the negotiations that went on between the two of you. I am very disappointed in that. And I hope that within now and the next couple of weeks, the two of you start talking. The two of you, I'm calling you groups. I'm looking at individual people, but I'm not. This is not an individual thing. It is important. And if you choose not to negotiate or talk, it's on you, not on us. That's not what we do. We do what we're doing now. This is what we do. We set up frameworks for people to get to work. And if you can't figure that out, and it can't be done in rulemaking, and it doesn't happen, it won't happen. But what we're saying is this is important. So please take that into consideration. Thank you.
Representative Simon?
Thank you, Madam Chair. Listening to the debate during the amendment session and just kind of gauging where people were at and trying to figure out how to address the committee on my thoughts on this bill. I've spent a lot of time talking with people on both sides of the issue and trying to get to the bottom of where things are at. I think, and speaking privately with a lot of ophthalmologists and a lot of optometrists, I've kind of come to a few conclusions. One is that the title that somebody holds in and of itself does not make one qualified to do something or not do something. The title itself is connected to the level of training, expertise, experience that somebody has accumulated. And that level of training, expertise, and experience is directed towards a scope of practice. So in the case of an ophthalmologist has a scope of practice that far exceeds that of an optometrist. And so their education far exceeds that of an optometrist. They do residency, they do fellowship, which allow them to expand on what it is that they want to practice. Now, I've had this conversation with both sides. When it comes to a fellowship, which is a specialty that an ophthalmologist would go into, to my knowledge, and nobody from the ophthalmologist side has said otherwise in my conversations with them, nobody goes into a fellowship for these procedures. They don't specialize in these procedures. They specialize in other kinds of procedures that are much more complicated and complex. First off, because I think it probably requires that to do it well. Secondly, I'm sure money probably plays a role because we're human, and that's just the way that works. That would be a motivating factor for me. Residency, yes, they go through medical residency, and it's very involved, and it gives them a scope of practice far beyond the particular procedures that we're looking at. And so they're there for 3 or 4 years. But that obviously in and of itself is not required for these specific procedures because the time spent goes well beyond these procedures. So we're not making a comparison between what the ophthalmologists do for education and these particular procedures and whether or not optometrists can do the same thing in order to practice these procedures. What I was trying to do the entire time was drill down and find out what education and experience is actually required to do these particular procedures. And I will say to my disappointment, I never got an answer to that. From the people who were able to provide it, I was never able to get to the bottom of that. Now, I would like to, just because I followed the same train of thought as Representative Goley, we are in agreement on this point, and I had a conversation with the gentleman from Kentucky and grilled him on it, and he was actually pretty upset with the answer that he gave during committee that day. I said, yes, it looked terrible. When he said, well, no, there is no minimum. But the answer that he followed up with was a good answer. And the answer to that question is there is no minimum because I believe, according to Representative Smith brought this up, there isn't a one-size-fits-all as far as how many procedures are done and whether or not a person is qualified or proficient in order to do the procedure, right? So you can throw 5 on there and 5 can be a minimum, but that's not going to tell you whether or not somebody's proficient. And therefore, it cannot be the last step in the process of determining whether or not somebody is qualified in order to do one of these procedures. So for somebody, it might be 5, for somebody, it might be 10, for somebody, it might be 20. So the second part of the process that's absolutely essential is to, yes, get those minimum procedures in, but then put that person under somebody who is qualified, who has been trained and can oversee the procedures to make sure that that person reaches a point of proficiency before they're released to practice on their own without that supervision. That will be required in this legislation. That is completely essential. To Representative Manjaputi's point, what I thought was very, very important. This is going to be a slow-moving process. No optometrist is going to be able to do this for over a year, well over a year. We're going to have to go through rules, and then whatever is put into place, those new requirements are going to have to be met. So once again, to a comment that was made earlier, yes, no schools at this particular point in time provide all of the training for this scope of practice. And also, my understanding is that none of the states that have legalized it allow optometrists to practice it simply based on what they got out of their schools, even if they went to one of the couple of schools that train this way. They also have had obligations put in place that require them to work under somebody and have somebody sign off on their proficiency. Nobody in the state of New Hampshire will not be an exception to that. Nobody allows an optometrist to do this without going beyond the scope of just the education at the college level. Nobody does that. Everybody recognizes you're not 100% ready to do these. They have been given a foundation, they've been given a framework, and yes, additional study is required beyond that in order for them to be able to practice and do these procedures. But somewhere, perhaps in the middle between an optometrist and an ophthalmologist, is a different space for which we don't, at the moment, have a title. We don't call it something because it doesn't exist. You either stop where an optometrist stops, or you continue on to where an ophthalmologist continues on to. But that does not mean that there isn't a space in the middle where we add educational requirements, where we mandate that they, I don't know what it will be, another year worth of training, whatever it is, in order to be able to do these kind of, from what I've been able to gather, and somebody can clarify afterwards if necessary, these intermediate procedures. They are not at the far end of the scope of complexity, and they are not at the lower level of an optometrist. They're somewhere in the middle. And can people get trained for that middle ground? And what would we call them? I don't know. Maybe they're optometrists with some sort of additional credential tacked onto it. You know, that can be hashed out. But I don't think I finished my thought, which is simply this. I'll be watching rulemaking. This is important. And that's when the people who know that part get involved. As has been mentioned twice at this table already, I believe, we're doing what we do. And I do think that actually what we do in the process has been done well. I think that we've set this up well for success. I think we've set this up well as far as what we can do for safety, in accordance with what we do across the boards. That this is what we do. If we feel, or the ophthalmologists feel, or whoever can bring it to our attention, that whatever rules are being put in place, the optometrists lie to us, and they are trying to skirt under the radar and do hack jobs of surgery on people, and we look at the rules and we're like, hey, wait, there is no way possible that that is going to meet the criteria. Anybody can bring me a repeal bill, and I will put it in, and we will gut the right to do that. But the fact of the matter is, and I'll finish up with this, Madam Chair, because I've talked a long time, but if this were to go to interim study, we would get no further information. We would not be able to proceed forward any further than we do. The only way, and I've asked, I really have, I've asked, and I haven't gotten the information that I believe the members of this committee are looking for. And yes, it may have only been in this committee for a week, but this has been going on all year long. This information should have been readily available for us to just ask and get direct answers to those questions right away. And I've asked and I did not receive, and what I did receive is in this amendment. I was perfectly happy to play ball, and I didn't receive that. By pushing it on at least to rulemaking and allowing the professionals to hash it out on the technical level to see whether or not this is going to work, that information will come out. It will have to come out. It has to come out. And once it's out, we have the opportunity to react to that. First through JLCAR, and if not through JLCAR, by bringing back legislation next year. Nobody wants to see unqualified professionals practicing in the state of New Hampshire. Nobody wants to put individuals at risk. And in order to figure that out, Madam Chair, I think we need to push this bill forward and get that additional information in rules. So I thank you for the committee's patience with me as I laid all that out, but I spent a lot of time talking to people.
Representative Goley?
Thank you, Madam Chair, and I'll be brief. We've heard a couple of times now, since we've had this amendment before us, looking at these two groups, asking them to continue to negotiate and come back with something. That tells me this bill as is not ready. Madam Chair, that came from you, and it came from the ranking member on my side of the aisle. So I don't understand why we are going forward with this, knowing that there's something else out there that could be made to make this bill better within these two groups. I've chaired many subcommittees in this House in my 24 years here. And the purpose of a subcommittee is to get the best product with the groups together. Not everybody wins, not everybody loses. Getting a compromise between the two groups. And if we have people sitting here at this table looking and telling you folks to get together and figure it out, then the work hasn't been done completely. And for me to vote on something that with work not done and saying we have time to figure this out in rules, I don't agree with, and I can't support this. I've been around long enough. Me and Representative Schmidt had this conversation last night on subcommittee work, and I think 1 2-hour subcommittee on a bill this complex isn't enough with the short, and I know we have a short time frame, and it was what we had to work with, but I think it could use a little more work, and I would hope we would do that. Thank you.
Okay, that's your opinion. Representative Schmidt?
So with the very strong vote that we just had on the amendment that definitely strengthened the bill. And I commend Representative Leckitz, as I said before, on the work he's put in. And this amendment has definitely strengthened the bill. And it's also made it less bad in some respects. Same difference. But the one thing I think we should not do is have a unanimous OTPA vote, because the House is going to go along with a unanimous vote, and I don't think I think
Representative Schmidt, it's not going to be unanimous. At least 2 people have clearly stated they are not going to vote for the bill.
and I'm going to be one of them.
3.
Thank you.
Now, that makes it 4. Okay. And I will say that don't know that there is anything that could be added. I'm simply saying the governor has asked if there is something that could be added to your comment. I'm not sure there is something, but I will also mention that when it came to the public hearing, the ophthalmologists were all saying, we get 7 years of residency, we're surgeons, we know what we're doing. And they were not dealing with the specifics of the procedures that the optometrists wanted to do. They were simply saying a hard no. And I think that if we pass this bill and start into rulemaking, we will get the ophthalmologists to actually look at what the requirements are in order to do these procedures safely and effectively. And I would imagine they do not require 7 years of residency. But that's my opinion. We'll find out. Anybody else? Okay. In that case, the motion is ought to pass with amendment on Senate Bill 440. And the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Santos Sasso.
Yes.
Representative Dolan.
No.
Representative Melvin.
Yes.
Clerk votes yes. Representative Boyd.
No.
Representative Brown.
Yes.
Excuse me. Representative Grota.
Yes.
Representative Schmidt.
No.
Representative Goley.
No.
Representative Schuett,
No.
Representative Malloy,
Yes.
Representative Davis, Representative Fitzpatrick, Representative Gould, Representative Smith, Representative Mangiapudi, and the chair.
Yes.
14 yea, 6 nay.
All right, this will not be going on consent. Representative Goley or someone else, does someone else wish to write? What's that? Representative Schuett will write our minority report.
Under what motion?
Your motion, Representative Schuett, will be interim study? Okay. All right.
With that, we have lunch.
Right, Mr. Greenland, do you have an estimate from OLS on what that amendment will be ready? What's that? All right, in that case, we will recess for lunch and come back at 2:15 to finish with our last bill. What's that? Yes. It's an hour, 2:30? Sorry, correction, we'll be back at 2:30. The motion that passed was, ought to pass with amendment. The minority report will be interim study. All right. Sorry for the delay. So we are resuming our consideration.
No dessert?
Not till we finish the work. All right, so this is this amendment is to add the this is to add amendment 1855 to Senate Bill 373, and that's moved by Representative Gould. Yes. Is there, well, she was here.
Got in somebody's car.
That's gonna go back.
She was riding with somebody.
She was riding with,
No, Bailey.
She rode with me today, but she didn't ride back with me.
She's with Glenn.
she's with Glenn. Oh, okay.
Yeah.
Brought her back.
They're pro-
She left her. She left her thermos of drink.
Tied down with Bailey.
And then I brought it out to my car, to bring it back. And she came over to my car and I handed it to her and she got back in that car and that's the last I saw.
Yes. Why don't you move the amendment? Rep, for,
I'll move amendment for Representative Gould. I will move amendment 1855H.
all right, is there a second? Okay. All right, and this is the same as House Bill 1252, but in an appropriate amendment. And, all right, so we're here to debate that, and I certainly hope Representative Bailey and Representative Gould show up soon. I see, okay.
So I could speak to my amendment.
If you would speak to your amendment.
Okay, so this amendment is a duplicate of House Bill 1252, which this committee voted and the House voted on. And we are adding it to Senate Bill 373 because the Senate chose not to pass House Bill 1252, which talks about a committee to study the needs of Native Americans in New Hampshire.
Okay. Representative Blackus, do you wish to speak to your second?
I think that's it. I mean, we debated this back when we dealt with 1252. Yeah, that's it does that, and then has the committee take a look at what's going on with the Commission on Native Affairs as well.
Okay. Okay, Representative Mangiaputi?
Procedural question, Madam Chair. So now this doesn't have to go back to Senate, correct?
Oh, it will go back to the Senate.
So if
And they will be asked if they want to concur with the amendment or not. They may choose to concur. They may choose not to concur and kill the whole bill, or they may concur and non-concur and ask for a committee of conference.
Okay.
If
So,
they
but,
ask for a committee of conference, we'll agree.
okay, thank you.
Okay, Representative Simon?
Thank you, Madam Chair. In the spirit of trying to give Representative Gould a couple seconds left to get back here. I can't support the amendment, not because I'm opposed to the amendment. I just don't see a path forward for it. And if we send this over to the Senate side, I just don't think that they're going to accept it. They were pretty staunchly against it in the first place. And I don't really want to have the underlying bill affected by it, or just really more likely adding another step to the process to arrive at the same conclusion. So, so for that reason, as much as it breaks my heart to not support Representative Gould, I will not be supporting the amendment.
All right. And Representative Schmidt?
Well, I'm glad to hear it. I'm glad to hear that, because I think they'll request a committee conference. They'll come in, our position will be the whole bill with the 1252. Their counter will be drop it or the whole thing goes down. And so I totally agree with the chair's remarks. And I would just counsel my colleagues to respect the testimony that we heard from members of the commission before the Senate. I was there and I heard them say it, that the committee is actually viewed by the commission as a salt in the gasoline, sugar in the gas, whatever you want to call it, antithetical, in other words. I should have stuck with the big words for the first place. Antithetical to the commission that we already have, that is functional if they can get a quorum back, which is what the other bill that we had as an objective. So in addition to the chair's very prescient remark about no path forward, it's not a good idea, in spite of the fact that it passed the committee. But as I said, 40 people were in the listening audience, if you will, and weighed in 38-2 against this bill, against this text of this amendment. So it's not really in the interest of the Native American Commission. Thank you.
Anyone else? Comments, questions? Representative Brown.
Thank you. I don't have my big binder with that original bill in it. Can anyone enlighten me on what the concern? There was some concern that there was inaccurate information passed around at the original hearing, and when we voted for this, and I can't remember that. If anyone, I'm not asking you to say anyone that is inaccurate. Sorry about that, but if anyone can enlighten my memory on why we decided to move ahead with this, how's that?
Representative Perota, you have an answer, you said?
I do. The concern had to do with the, let me read this. Oh, no. Okay. I'm incorrect. What I thought was here is not in this bill, so I take it back. Sorry.
Part of it, I think, was the idea of state recognition and what that implied, because we aren't really sure what it does imply, but it's different than federal recognition.
Thank you. Yep.
Representative Blackus?
Yeah, I believe on the state, I mean, there's, Representative Gould's back, maybe she can answer better, but my understanding is there are some federal law that will apply if there's state recognition, so having the state recognition would affect that. The other thing is, I take Representative Smith's comments about the commission, but there's also, I think, some reason to believe that the commission had some functionality issues beyond quorum, and so I think part of the idea was to see if there might be some changes to the commission, either membership or their charge, that might have allowed it to work better. And so I'm not surprised they were opposed, but I don't think that's dispositive. No.
Okay, Representative Gould and then Manjaputi.
Thank you, Madam Chair. My apologies. Glenn and I took the best route, the quickest we could to get here. Okay, I'm going to speak a little more openly than I've spoken in the past. I've worked really hard to be cooperative and try to get through this process in the most productive way possible. The reality is that, as I stated earlier, we were told that we had a representative of the commission working with us, but then there was a change, and the rest of the commission wouldn't honor what the commission member had agreed with. There are many factors, they're complicated, but one factor I can tell you is that, and it is a fact, that a couple of years ago, all of the Native Americans enrolled in recognized tribes, both federal and state recognized tribes, quit the commission at the same time in a week's time. And that's been a big part of what led to the loss of seats. And as we all know, the governor's office is very, very slow to make those appointments, to refill those seats. Of course, I was blamed for those seats not getting filled, which of course I had nothing to do with, and I would only advocate for those seats to be filled. I've advocated for the commission with Representative Dolan's committee. Again, I was blamed that that I was trying to kill it. It's, you know, we cannot understand what the opposition is because we're not getting forthright, honest answers. We're not getting cooperation. I reached out to the commission when I did the first bill on recognition, and they were working with me until there was a thing they wanted, and I was trying to talk to them openly and honestly about why that would be a problem, and they just quit talking to me. So it's this lack of communication, even when you try, that's part of the problems. And the study committee is to give some legitimacy and credence to the path to recognition. And there are many reasons, as has been said here, why state recognition matters. Other people are entitled to hold a different opinion that it doesn't matter, but it does matter. And a quick example I'll give you is that 603 Diversity just came out with an article totally dedicated, or largely dedicated to the Abenaki. There's many articles in it. One of them is my husband making his birch bark canoes under the birch bark article. But there's another one written by the chair of the commission, who is the one who opposed this bill, where she talks about the Abenaki, and she talks about the Vermont tribes, and then she talks about 3 groups in New Hampshire who are not recognized. So this is what we've been battling, is that those of us who live in New Hampshire who were not given a path to become legal Indians under the federal law by enrolling in a recognized tribe, as soon as Vermont recognized a tribe, in order for any of us to sell our arts and crafts, we would be illegal. And so the only path to follow federal law was to enroll in a tribe. And since that happened in 2011, we're now characterized as foreigners in our own state. So these issues are complicated. They can be very painful for some people. They can be very threatening to some people who may not have the history and background to meet criteria. But then again, they may have the history and background to meet the criteria, and we won't know until we study it. I think that's about all I want to say on it.
Okay. Representative Mangiapudi?
I don't know if I can follow the suit with what you said. My understanding was that the representation on the commission from all tribes was not equal, or it was not represented. And so that was just my simplistic mind understanding that unless all tribes are at the table on this commission, it's really not a fruitful thing to do. That was my understanding. I could be totally wrong, but that was where I'm going.
Mm-hmm. Anyone else? Yes.
Thank you, Madam Chair, for allowing me to follow up. There is one other piece I'll say, and my esteemed colleague to my left said to me on the way in just now, I really don't know enough about Native affairs to really understand the issues. And I said, yes, that's the problem. And my husband is just astounded that the response to we don't know enough about it has been, so we're going to kill studying it. That it just is incongruent, that the way we're going to learn about it is to work with the commission as a study committee gets formed, invites the commission to come to the table. Everybody starts to hear open and honest communication happening, then an understanding can grow from that.
Representative Brown.
Thank you, Madam Chair. If this were to go to a committee of conference, would we whoever that is, would we abandon this piece so that we didn't lose 373? I know you don't know. I can't predict
I
the
don't
future.
know. It would depend on what the Senate wanted
All
and
right.
how strongly they wanted it and how strongly we want the other part.
Okay.
It could go either way. Okay, anyone else? All right, the motion is to adopt Amendment 1855 to Senate Bill 373, and the clerk can call the roll.
Representative Simon.
Regretfully, no.
Representative Lakis.
Yes.
Representative Bailey. Representative Dolan.
Yes.
Clerk votes no. Representative Boyd.
No.
Representative Brown. Representative Grota.
Yes.
Representative Schmidt.
No.
Representative Goldie. Oh, he's not here. Sorry. Representative Schuett.
Yes.
Representative Davis.
No.
Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiaputi. And the chair.
No.
9 yea and 6. Yeah, 9 yea, 6 nay. Sorry.
Okay, the motion passes. Does someone have a motion? Representative Gould?
Yes, I'd like to move the bill, House Bill 373, is it?
Yes.
With the amendment to ought to pass.
Okay. Is there a second? Okay. Do you wish to speak to your motion?
I think I've said everything I need to say. The underlying, the original bill, as I said before, I think is really important as well. And I really appreciated the chairman's explanation that in the committee of conference, there's wiggle room either way. But preserving air change is important to me as well.
Representative Lakis, do you wish to speak to your motion?
Nothing to add.
Okay. Anyone else? All right, well, I'm concerned about losing the content of the bill, but we'll see. Okay. The motion is ought to pass with amendment on Senate Bill 373. And the clerk can call the roll.
Representative Simon.
Yes.
Representative Lakis.
Yes.
Representative Bailey.
Yes.
Representative Dolan. Clerk votes yes. Representative Boyd.
Yes.
Representative Brown. Representative Grota. Representative Schmidt.
No.
Representative Schuett. Representative Davis. Representative Gould.
Yes.
Representative Smith.
Yes.
Representative Mangiaputi.
Yes.
And the chair.
Reluctantly, yes.
13 yea, 2 nay.
All right, the motion passes 13-2. I object to consent, so we won't put it on consent. Representative Schmidt, or Davis, will either of you be writing a minority report?
I will have to confer with members of the commission because I think we should look before we voted. I meant to speak to it, but you were already cast the die, so to speak. Whether there are people watching meeting of this committee and this vote, because if they are and we are and we are ignoring their counsel and their vote, then I think we're acting to our own disadvantage.
Okay. Representative Davis, are you, no, okay, well, fine, that is the last of our bills. The committee reports are needed. We'll take them tonight. Representative Schmidt, you owe one for 302. Representative Simon, 371. Representative Broder, you've got 485. I have Representative Gould's on 488. And Representative Lekis is on 600 and 318. And 440 was forthcoming. Okay. So Representative Gould, you owe also owe one on 373.
Thank you, Madam Chair.
If you like, I'll send you what I had written for the ought to pass.
That would be lovely.
Okay. That's that. And thank you. That is our, as far as I know, this is our last committee action until the fall. Anyone that has responsibility for one of the interim study bills will be expected to write the report on it and hopefully do the study. If you want to volunteer for any of those study committees, please talk to the person who's the leader on that, and it's posted in the office. Anybody else have anything? Representative Mangiapudi.
Thank you, Madam Chair. I just want to say thank you for including me in this, being part of this committee. This is my last time. I'm not running again, so I kind of feel good about being on this for just a year, but very enlightening and very inclusive committee, and I thank you for running a great committee and subcommittee, and I felt very part of it, and I appreciate that.
Okay. Representative Lekis.
As I think people know, I'm not running again. Also, my name was on the interim study for House Bill 1333, which is banning EVs in state fleets. They're going to need somebody else to take it over because I'm either going to be out of town or out of the country for much of the time the study would be done, and certainly for the meeting in the fall.
Okay. Anyone want to volunteer for studying EVs?
What is the, hello? What's the schedule for doing interim studies?
You can, since we have completed our committee work, you can start now. July is off. Usually most of August is off. There's a report due sometime in October. So. Yeah. Representative Gould.
Thank you, Madam Chair. I was just going to say that I have two that I've got named for. One is Atlantic Time, and the other is what's left of merging boards, surveyors and scientists and all some other stuff. I would be happy to take on the EV if somebody else would take on one of those other two bills, study committees.
Well, to be honest, we've decided that the Atlantic Time doesn't need anything anymore because the other bill is gone, so.
You want to co-chair it, Carol?
Anyway, let me know what anyone decides. We don't need to know today. All right.
Yes, I would. Yes, I will do that with you,
The
Representative Gould.
EVs or?
The EVs.
Okay, we'll change the name.
Yeah, the mics are having an issue here.
Okay, well, does that. All right, anyone else? Representative Smith?
Oh.
Okay, thank you. We'll see what happens. What the voters decide. That's always the issue. All right. Thank you all. And